Good morning, everyone. My name is Derek Davis, and I'm chairman of the House Economic Matters Committee. Today is Friday, February 5th, 2021. We have but one bill before us today, House Bill 581, but oh, what a day are we going to have. I am looking forward to spending the next several hours with you as we debate this bill. Before we get started, before I get started explaining the bill, I'd like to, I don't want to on ground rules, but I want to lay out some expectations and address a few things first. Number one, and especially for those of you who regularly participate in this process, you know that with the introduction of any bill of this magnitude, that it is a starting point, not an end point. No one's accusing anyone of being a bad actor. No one is saying that this pandemic is your fault, that you contributed towards it negatively in any way. That is not my intention. That is not what I'm doing. However, we do have a situation, and I hate to keep using that word unprecedented, but that's what we have. We have an unprecedented situation, and we simply can't ignore the safety of our fellow Marylanders. For me, I think about, and then this is no way, again, attributed to the business community or any of our nonprofits, but I cannot forget the 360,584 confirmed cases we've had in the state. It hasn't even been a year yet. I can't forget the 7,109 confirmed deaths. I cannot forget the 178 probable deaths. I can't forget the currently hospitalized 1,444 residents, the 1,103 in acute care, the 341 in intensive care, the 32,687 that have been hospitalized, and even the 9,514 who've been released from isolation. You want to know why Derek is bringing a bill like this? It's because of that type of situation. Again, this was not the fault of the business community. You're not being, I'm not laying blame at your feet, but these are our fellow citizens, and some of them, can't tell you exactly how many, but some of them did get COVID from the environments that they were in. One of the things that concerns me, that bothers me, quite frankly, is, and I see it all the time with our military folks, we love to call them heroes. We thank them for their service. We praise them and give them all these accolades. But what we don't do, at least in my opinion, well enough, is meet their basic needs. We don't help with the mental health aspects that some may be going through, the joblessness, the homelessness, things of that nature. And for me, it's simply not essential to say thank you. And simply, and I bring that up to use in this example with our essential workers. We call them heroes, we praise them to the hilt, and it's deserved. But they deserve more than just our praise. They deserve more than our praise. See, for me, I got to sit home all interim, and I did my work, and with my colleagues and some of the folks that are going to testify, we Zoomed. We were nice and comfortable in our offices and our wherever we were, but we weren't on those front lines, at least not regularly. We weren't out there at the grocery stores and the hospitals and things of that nature, exposing ourselves and our families to danger on a daily basis. And I just kept thinking about that, and it bothered me. All they were getting was thank you. They weren't getting the same benefits, the same safety precautions people like me were getting safe at home. So that's the genesis of where this is coming from. It's not enough for me to say thank you. And for those, I get it, for those who say, the bill's overly broad, I interpreted that means it includes me or my client. It's poorly crafted. that means we can't figure out how to get out of it. All these other things that go on. That does not mean that the bill is perfect. I'm not saying that. It was designed by intention to be broad, and we work from there. We talk, we walk through it and figure out, okay, maybe these folks should be in it, or maybe these folks should not be in it. And we work our way through. This isn't going to be a quick process. I was having a conversation with the vice chair earlier, and I fully expect, if we're able to reach a consensus on this, it's going to take up most of the session. And that's why we're having an early hearing on this Friday, February 5th, to give us that time to walk through all of the details of the bill. We want to get this right. Like I said, if we're able to do this, we want to get it right. And we want everybody's voices heard and at the table. We've done this before. This is nothing new for this committee. C, minimum wage, C, paid sick leave. We've had big bills before. Many of you that I see, you've been right there with us. Nothing was shoved down anybody's throat. Everybody had a seat at the table, and we compromised. So I just want you to keep that in mind as you're testifying. Relax, I guess, of that what I'm saying. Just we all, including myself, starting with me, take a deep breath, and and this is like any other piece of legislation that requires work and effort on everybody's part. Now, with that, let me get started by saying this emergency bill establishes employment standards during an emergency for essential workers who work for essential employees in specific industries. The scope of the act covers workers in a range of industries who must perform job responsibilities in person and cannot do so remotely, even during an emergency. Emergency covers incidents that are subject of an executive order, declaration, or proclamation, or that presents the imminent threat of severe loss of life, injury, or other health impacts, property damage or disruption, social or economic disruption, or environmental degradation. MEMA, or a local organization for emergency management, must announce publicly in writing that an emergency is occurring and that essential employers must comply with the hazard pay, health insurance coverage, and leave benefit provisions. And when an emergency has subsided, announce publicly in writing that essential employers no longer need to comply with those provisions of the Act. Now, in terms of benefits, the Act requires an essential employer to provide hazard pay of $3 per hour worked for essential workers for those making less than $100,000 per year. In general, this is retroactive to the start of the emergency, but with the current pandemic, workers begin earning hazard pay on the date the bill goes into effect. They also get in terms of benefits, reimbursement for healthcare expenses and facilitates an essential workers access to coverage on the Maryland Health Benefit Exchange. Provide at least 14 days of paid health leave for illnesses or health needs related to the emergency. Provide at least 3 days of paid bereavement leave for the death of a family member that resulted from the emergency. In terms of employment safety standard, the Act requires essential employers to provide working conditions and PPE, establish written protocols, and implement other safety measures to ensure the health of workers, and prepare a health emergency preparedness plan, and annually review the plan, submit changes to MEMA and the relevant local emergency management agency, and take specific proactive steps to minimize risk of transmission of infectious diseases, including reporting specified positive test information to the Maryland Department of Health. Essential workers are to notify the Department of Labor of any unsafe working environment. Doing so triggers a sequence of events that could result in the worker being protected from retaliation for refusing to perform a responsibility in an unsafe work environment, and or could subject the employer to civil penalties. and the commissioner to adopt regulations to carry out the provisions of the act. An essential worker may refuse to fulfill duties that relate to an unsafe work environment, and an essential employer may not take specified actions in retaliation. Establish a special enrollment period on the Maryland Health Benefits Exchange for essential workers who do not have employer-sponsored group health coverage. A prohibition on misclassification, intentional or unintentional, of essential workers as independent contractors. A 2-year period for filing complaints with the Commissioner of Labor and Industry. And enforcement remedies include commissioner is required to investigate on receipt of a complaint or authorized to investigate on the commissioner's own initiative. Commissioner required to issue an order compelling compliance and authorized to impose a civil penalty of not more than $1,000 and award compensatory damages and other relief, rescission, discipline, reinstatement, back pay, and attorney's fees. Commissioner required to consider various factors when determining the amount of the civil penalty. Now, how is an emergency defined? An emergency is an imminent threat or occurrence of widespread loss of life, injury, or health impacts, property damage or destruction, social or economic disruption, or environmental degradation from natural, technological, or human-made causes, or an incident, occurrence, or outbreak that is subject in an executive order. Again, as mentioned, how is the emergency declared? By an executive order, declaration, or proclamation. The scope of the bill goes beyond the current pandemic. An essential worker is an individual who performs duty or work responsibilities during an emergency that cannot be performed remotely or is required to be completed at the work site. Does it apply to units of government? Yes. That's been a long-standing policy of the committee. Anything we ask of the private sector, we most certainly will ask of the public sector as well. How is the $3 amount for hazard pay determined? It is the common amount found in collective bargaining agreements. Additionally, the payment of hazard pay is not retroactive. Is there a funding source for the hazard pay? For state employees, there is an unanticipated surplus in the state workers' compensation self-insurance fund due to the telecommuting of non-essential state employees. And so that's all I have for now. I hope it gave what we call legislative intent of what the bill is designed to do. Again, there will be work groups and all sorts of things where we can come together and have a good informed discussion about best practices for Maryland. And with that, I think it's now time that we get started to the witness list. And with that, I'm going to open up with Mr. Wynton Johnson. Is Mr. Johnson with us?
Yes, sir. Yes, sir. Good morning, Chair, Mr. Chair, and Madam Vice Chair, members of the committee. My name is Wynton Johnson. I'm the President Local 631. I work for State Highway Administration Facility Maintenance Technician 3 in Upper Marlboro Shop. I am asking you to please support the Maryland Central Protection Action for me and my fellow co-workers who have been working every day since the pandemic started. We are frontline workers. Our starting pay for this position is $30,000 yearly. We got hazard pay 1 week, and then the governor cut it off. Meanwhile, we're responsible for the traffic for the COVID testing sites at Prince George's County, at Six Flags. We direct people where to go. People will pull up to us, roll down their window in close proximity and speak to us, and then continue on after asking questions. The only PPE that we have had was the PPE that we purchased for ourselves. State Highway still haven't provided us with the proper PPE because the masks that they gave us were real small that our kids could fit, we couldn't fit. and we're still doing the same way. I caught COVID, which was very painful to me and my family because the only thing I do is go to work and then I come back home. Excuse me. I had diarrhea. I had body aches. I couldn't talk. I couldn't eat. I lost weight. I had frostbitten fingers and lost all kinds of taste. I was sick for 3 weeks. Out for 3 weeks. The transition and coming back was scary to me because I was worrying about giving my fellow employees the COVID and them taking it home to their family and not knowing if they have the proper time to take off for the COVID leave because we're down to using our own leave because of because they didn't carry it over. Excuse me. Everyone just know us as working with ice and snow, but we do much more, and we have been working face to face with the Maryland people and customers throughout the whole pandemic. But we deserve hazard pay doing this, and we urge the committee to provide favorable report on this bill. And I thank you for giving me time to speak with you all.
We have a lot of witnesses, so we'll take questions, but I ask that you be real judicious on it. There are a number of people that are signed up to speak, and I don't want to have them waiting too long. So is there anything for Mr. Johnson? If not, IKEA Cornish.
Good morning, Mr. Chair, Madam Vice Chair, and members of the committee. My name is Ikea Cornish. I'm an ASME Local 770 member, and I work at the as a direct care assistant at the Eastern Shore Hospital Center located here in Cambridge. I wanted to talk to you all a little about what it's like working in a facility that has largely put in place all of the protections guaranteed in the Maryland Essential Workers Protection Plan. Similar to nursing homes, I work at a long term care facility for psychiatric patients. They live there. So the virus could only get in if someone like myself or my coworkers bring it in. These patients are like family to us, and that's an enormous responsibility. I'm glad that my management put an outbreak prevention plan in place. They were very proactive. It included screening protocols, weekly facility based testing, PPE procedures, cleaning and disinfectant procedures. And they made sure to tell us about the emergency paid sick leave that the federal government passed and encouraged us to, utilize it if we were exposed or felt sick. Um, I'm proud to report that to you all today. We have had zero patient and staff deaths, and we've been able to control any outbreaks that we had. But to say that 30 minutes down the road, there's a facility, state facility that service disabled individuals, and the staff there were forbidden to wear masks to work, even though we all are under the same umbrella. Of the Department of Health. We need additional pandemic leave if we want to control our success. As people are now being quarantined for the second and third time, they have ran out of the time and are forced to either use their own or go with unpaid leave. Our patient lives depend on people staying home when they are sick or has been exposed. Um, we need to get those barriers out of the way so that we all can have a safe working environment. Um, Although these are the jobs that we chose, we show up every day working overtime in short staff facilities, giving 100+%. We're putting ourselves and our families at risk. We all deserve, no matter where we work, to have managers who care about our safety. The Maryland Essential Workers Protection Act can help to keep people safe. I've been the I have been one of the first to witness that. Um, we need this law so that there are universal protocols for every worker like me that risk their lives to help others. I urge this committee to give a favorable report on this bill. Thank you very much.
Tyra Robinson. Ms. Robinson, there?
Yes, hello, can you hear me all right?
Yes.
Okay, good morning, Chair Davis, Vice Chair Dumais, and members of the committee. Thank you for the opportunity to testify today. My name is Tyra Robinson, and I'm an attorney at the Public Justice Center and work in the Workplace Justice Project. The PJC is an anti-poverty civil legal services nonprofit working to advance social justice, economic, and racial equity. The Workplace Justice Project works to expand and enforce the right of low-wage workers to receive an honest day's pay for an honest day's work through litigation and policy advocacy. The PJC supports HB 581 and requests a favorable report for these reasons. First, HB 581 will keep Maryland safe during emergencies such as COVID-19. Essential workers in all industries have worked in person throughout the pandemic to keep Maryland running. Too many of these workers have also been denied adequate personal protective equipment, access to sick and safe leave, or health insurance, and the power to refuse unsafe working conditions that pose a risk to their health or safety. When forced to work without adequate protections, they can spread the virus to patrons as well as their coworkers, families, and communities. HB 581 requires such personal protective equipment and requires emergency preparedness plans for future emergencies, which will minimize devastating impacts and ensure employers are not left unprepared. Second, HB 581 will enable essential workers to protect themselves, their families, and their communities. Many essential workers lack earned sick leave or enough of it to survive an emergency like COVID-19. Even worse, they cannot afford to grieve in the event that they lose a loved one in an emergency. Relieving essential workers of this excruciating choice between a paycheck and their health allows essential workers to stay safer at home, help flatten the curve, and limit the spread of contagious illnesses. Even more, HB 581 will also compensate essential workers with $3 hazard pay per hour for the additional risks they face by continuing to report to work in an emergency, even after they receive PPE. Finally, HB 581 will impose retaliation protections under certain conditions. The PJC has heard from and represented workers who have been reprimanded or threatened for raising health or safety concerns in the workplace. Others have been completely silenced. Most felt forced to continue working for fear of economic consequences, despite the health risks that came from working in these conditions. All of these complaints were reasonable, justified, and likely concerns that you or I would have also raised, such as lack of PPE, failure to provide physical distancing among staff, and lax cleaning procedures. In order to ensure that the protections afforded by this bill are fully realized, workers must be free to raise these concerns. And such freedom demands that workers be well protected from retaliation, including the fear of retaliation. The right to refuse unsafe work is a public health measure, and robust protections from retaliation can make that right meaningful. In this regard, the PJC would welcome the opportunity to work with our allies and the committee to strengthen certain retaliation protections in the current bill. However, for all the reasons stated here and in our written testimony, I urge the committee to give a favorable report on HB 581. Thank you.
Thank you. Anna Palmisano.
Yes, thank you, Mr. Chairman, Vice Chair, and committee members. I'm Dr. Anna Palmisano. I'm a microbiologist and the director of Marylanders for Patient Rights, a patient advocacy coalition. We strongly support HB 581, the Maryland Essential Workers Protection Act. HB 581 will provide vital protections which will help to preserve the health, safety, and livelihood of essential workers and their family members. We as a society owe these workers not only a huge debt of gratitude, but also the means by which they and their families can remain healthy and maintain their source of income. Yet during the current pandemic, essential workers were all too often left without personal protective equipment, adequate testing, or hazard pay while they risk their lives to protect others. While all the protections in this bill are of critical importance, I'd like to highlight the need for essential workers to be provided with sick and bereavement leave and with hazard pay. And I'd like to share a personal story. We were so fortunate to have a wonderful caregiver at a local assisted living facility who cared for a family friend with advanced dementia. When the caregiver lost her husband last summer, she was only able to take 2 days of leave. The day her husband died, and the following day to notify her family and plan a funeral. In addition, my family friend, like many who suffer from dementia, refused to wear a mask. This put her caregiver at additional risk in a congregate living situation where she was working face to face with an unmasked individual. This is just one example of why hazard pay and bereavement leave are so important for essential workers. When COVID was raging through nursing homes in the spring and the summer, I advocated to try to make sure testing was available for all caregivers, including those from home health care agencies. What I ran into was that the assisted living facilities said that the testing of the agency caregivers was the responsibility of the agency. And the agency said that it was the facility's responsibility. So dozens of vulnerable caregivers went untested. When I called the Montgomery County Health Department to report my concern, they told me, and I quote, "These workers have fallen through the cracks." Our essential workers deserve better. The standards and procedures outlined in HB 51 are common sense, reasonable, and critically needed. I strongly urge the committee to provide a favorable report for HB 581 to keep all our essential workers safe and protected. Thank you so much.
Thank you. Clint Sobrati. AG. Mr. Sobrati, are you with us?
Yes, can everyone hear me?
Barely. Can you put the volume up a bit?
Yeah, is this better?
Yes.
Hi, good morning, Mr. Chairman, Vice Chair, and members of the committee. My name is Clint Sobrati. I am a resident of Legislative District 39 in Montgomery County, Maryland. I am a devoted father and husband and a Montgomery County Transit Coordinator who has been an essential worker for Montgomery County Department of Transportation right-on for the last 10 years. As a transit coordinator, I am tasked with monitoring bus reliability, including mechanical malfunction, on-time performance, and customer engagement. As an essential worker, I can personally attest to the risk factor our transit operators are facing. When the global pandemic first emerged, transit operators were not provided with adequate safety protection such as masks, gloves, hand sanitizer, and partition between drivers and passengers. Instead, transit employees were responsible for obtaining their own PPE. This placed drivers at risk for exposure to COVID-19. There has been 2 fatalities in our transit family. On April 15, 2020, Mr. Michael Miller, a Prince George's County resident and a 9-year motor pool attendant, was Montgomery County's first essential employee who succumbed to COVID-19. Recently, Mr. Nelvin Ransom, a retired bus operator and a former recorder who was a member of the UFCW Local 1994, died as a result of COVID-19 complications. Although essential workers have been mandated to report to work during the state of emergency, there has not been hazard pay to compensate that risk. Many of my colleagues have experienced significant psychological distress, including anxiety, frustration, and paranoia. Studies indicate that job satisfaction increase and frontline workers are more likely to report to work if there is a pay incentive, as well as other protocol in place to ensure their health and safety. I am proud to be providing service to a community during this state of emergency. I only ask that transit employees and other essential workers be fairly compensated and be provided the health protection needed to do their job safely. In sum, this legislation will provide improved wage and working conditions for essential employees. they will be eligible for hazard pay and bereavement leave, and will have the right to refuse to engage in work in an unsafe environment. The Maryland Sierra Club urged a favorable report to better protect frontline workers who risk their lives and their family lives every day for the greater good of our state. Thank you.
Thank you. Couple things I neglected to mention. This bill is jointly signed with the Appropriations Committee, so I'd like to welcome Delegate Ben Barnes, Delegate Barnes, Delegate Grist, and Delegate Bridges. They should be here with us. And also, I should have done it at the front, so I'd ask that he forgive me, but Attorney General Frosch is with us, and he will be testifying now if you're ready, Mr. Attorney General.
I am ready, Mr. Chairman, and thank you very much. I think the glitch was on our end. We didn't get a link, so at any rate, it's a pleasure to be with you. I'm pleased to be here to support what I think is an extremely important initiative. As you know, Mr. Chairman, our office put together a task force, the Attorney General's COVID-19 Access to Justice Task Force. We had members of the legislature, the judiciary, our congressional delegation, business leaders, advocates. We had more than 250 people participating in this task force, and they made 59 recommendations. And among the most important were recommendations that you have essentially enshrined in your bill. We recommended that essential workers be protected during this pandemic. Folks who are putting their lives on the line when they go to work and providing services that are absolutely essential to the rest of us. Those folks need to be protected by us because we need them to be able to go to work. We need them to be able to do their jobs, and we need them to be able to do it without the fear that their lives are on the line because they're performing these essential services. And I'm pretty sure that people will be concerned that this bill will add additional costs to businesses, and it may well do that. But you know, this is a balance that is extremely important to strike, one that we've recognized for over 100 years and put in law at the federal level just about 50 years ago with the Occupational Safety and Health Act. We cannot ask people to go to work and risk their lives and not take steps to protect them. And, you know, we had an executive order by the President of the United States months ago where he said, folks who are doing meat processing, folks who are doing chicken processing are essential workers. They're ordered back to work. And yet the places that they worked were always dangerous, but much more dangerous during the COVID-19 crisis. They stand shoulder to shoulder using knives and working fast, and with no PPE, no separation of 6 feet, no ventilation that protects them from aerosol transmitted diseases like the COVID-19 virus. So we think that this legislation is extremely important. At some point, it is, I think, appropriate and necessary for the General Assembly to look at permanent protections all year round against aerosol transmitted diseases. And when I say all year round, I mean whether there's a pandemic or not. These are considerations that need to be reviewed by the General Assembly. But in the meantime, your bill that puts them in place during this pandemic is absolutely essential, just as essential as the workers who are doing this important work for all the rest of us. So thank you very much, Mr. Chairman, for the opportunity to testify.
Thank you, sir. David Stephen.
Uh, Good morning, everyone. Thank you to Chairman Davis and to the members of the Economic Matters Committee and those that are here from other committees as well. My name is David Stephen. I am the Political and Legislative Director for the Metropolitan Washington Council, AFL-CIO. The Metro Washington Council has 150,000 union members that are affiliated throughout metropolitan Washington, D.C., and that includes Calvert, Charles, Montgomery, Prince George's, and St. Mary's counties. Our workers include healthcare workers, bus operators, grocery store workers, educators, and more. We cross the gambit of industries and crafts throughout this state, and we are wholeheartedly in support of this essential legislation. You have our written testimony, and you will hear a number of stories from frontline employees that we stand in solidarity with. So I want to make our position brief on why this legislation is important. Number one, statewide standards and protocols that apply to every industry can stop people from dying. Number two, people who put their lives on the line ought to be compensated for the risk that they put themselves, their families, and our communities in and day out. And finally, we can't go another day and lose another life in this state or in this region, knowing that we could have done more. This legislation is our test to see if we truly value human life and value the work that residents of Maryland do to make our communities operate and in many cases thrive. Some employers do the right thing. Others don't know how to. And yes, there are employers who choose not to do the right thing. So we can correct that by doing the right thing today and get the working people in Maryland the protection that they need and deserve. And that's why we ask for a favorable report on this bill. Thank you very, very much.
Thank you, sir. Donna Edwards.
Good morning, Mr. Chair, Madam Vice Chair, and members of the committee. I'm Donna Edwards. I'm the president of the Maryland State and DC AFL-CIO. And on behalf of our 340,000 members around the state, we absolutely are in support of House Bill 581. And we thank the chair very much for his leadership in this endeavor. Every single day, in the face of personal threat to their own health and safety and that of their family, and in direct defiance of the coronavirus, workers showed up. They did their jobs around the state. They provided all of us House Bill 581 and the food we eat, the buses and trains we ride, the government services we rely on, the healthcare needs that we must have, and they met, and they touched nearly every facet of our lives. Honoring essential workers for their grit and determination in the face of a global pandemic, it's admirable, it's welcomed, but to truly express our appreciation, we need to change public policy in Maryland so that our deeds reflect our words. House Bill 581 sets a solid policy to protect essential workers, to not only thank them, honor them, but provide them the dignity and the respect that they earn every day. But it is not enough to praise essential workers verbally or in print while doing nothing to provide them with the support that they need to continue the work. So for all of the essential workers in Maryland who have gone above and beyond, who have put their health and their families' health and indeed their lives at risk during COVID-19, we ask for a favorable report on HB 581. And thank you very much.
Thank you. Larry Casecamp. If you're with us, Larry, you're muted.
How about now? Can you hear me?
There you go.
Okay. Good morning, Mr. Chairman, members of the committee. Larry Casecamp, Legislative Director for the Smart Transportation Division, in support of House Bill 581. We represent conductors, engineers, trainmen, switchmen, utilitymen, and yardmasters in the railroad industry who work in freight and passenger service in Maryland. SMART represents over 216,000 members throughout the country. Our members perform and assist with various functions for shipping and transporting essential goods and materials, including food, pharmaceuticals, raw materials, fuels, chemicals, energy, products for wholesale, as well as the functions and services for transporting passengers, by mass transit. This puts them in unavoidable interactions with the general public and places them at the highest risk among the essential workforces. During the pandemic, our members have continued to go to work each day to provide necessary functions to keep our economy working, while at the same time providing critical support in response to the pandemic. In doing so, many have contracted the COVID-19 virus, which resulted in some of them passing, some becoming very ill, and others jeopardizing their family's health also. Others had to quarantine for being exposed to other workers or the public who had the virus. Many lost paychecks and benefits as a result. This legislation addresses many of the hardships our members, Maryland's essential workers, have experienced. So thank you for your time, and we ask for a favorable report on House Bill 581.
Thanks, Larry. Tell you what, guys, in the interest of fairness, I'm going to go to a panel or two of the opposition now. I don't think it's fair to go 2 or 3 straight hours of favorable and then get to the opposition. So we'll do a little back and forth. Kaylee Locklear, let's start with you, please.
Good morning, Mr. Chair and honorable members of the committees. It's nice to see you all. Kaylee Locklear here on behalf of the Maryland Retailers Association in opposition to this legislation. And before I talk about our opposition, I just hope that we all acknowledge that the vast majority of businesses are and have been good actors. They have been protecting their employees and the public seriously, and some have even provided benefits that are in this bill already, even paying for immunizations. I submitted written testimony to you all that goes line by line through the bill, but because of time, I'm just going to focus on a couple of areas in an effort to not be repetitive, and I want to adopt the concerns that will be raised by my colleagues who follow. With regard to PPE, we would be fine with language stating if an employee cannot obtain proper PPE, we can help provide. But the bill must be contingent on the supply chain. And even the fiscal note recognizes the massive costs that could be incurred here. And I think we're all aware that last year there were times where none of us could even obtain certain products, including masks. In reference to employer paid testing, we'd ask that this is struck from the bill. Because of the definition of emergency that's found on page 3, line 19, and Ashley from the chamber is going to discuss some of these definitions, to the definition of infectious disease on page 14, line 20. The mandate that an employer pay for testing literally just covers any sort of testing. But with regard to COVID, which I believe is the intent, the state already offers testing for free, and even private entities will test for free for exposure and symptoms. So I'd also like to remind the committee as well that sometimes testing is just not available. The language on page 17, lines 23 through 26, that an employer has to provide financial assistance for unreimbursed healthcare costs to essential workers who become sick. And I'd point out the rabbit hole of definitively pointing out where COVID is contracted is nearly impossible, should also be struck from the bill. Finally, on page 10, the components of the bill mandating protocols and an emergency preparedness plan are absolutely workable. But the state and/or MEMA should provide a template for employers. To ensure proper emergency preparedness planning to help employees and businesses alike during a crisis, guidance must be issued by expert professionals in developing disaster management protocols and guidance. And because I have a second here, I want to draw your attention to the Washington Post article from February 3rd, which discussed multiple permanent grocery store closures that occurred when such a measure passed in Long Beach, California. Thank you for your time.
Ashley Duckman.
Good morning. Thank you, Chairman Davis, Vice Chair DeMay, members of the committee. Appreciate the opportunity to appear before you today. For the record, Ashley Duckman. I'm here on behalf of the Maryland Chamber of Commerce and our more than 5,000 business and federated partners from across the state in opposition to House Bill 581 as it is presently drafted. It is perhaps the grossest of understatements when I say that COVID-19 has had a tremendous, far-reaching, and yet fully unrealized impact on our state and on our job creators. Up until our most recent job report, in fact, nearly all of our economic indicators were moving in the wrong direction with no clear end of this virus in sight. The vast majority of my members continue to struggle to keep people on payroll and maintain operations, many operating at reduced capacity still or unable to reach their full revenue potential. Simply put, the requirements and associated costs in the bill before you today would be absolutely devastating to Maryland's job creators who are already struggling to overcome a global pandemic and compounding financial implications of other state mandates. I've only had a chance to briefly review the fiscal note, but as you can see from it, the costs to the private sector and state and local government are astounding. But beyond cost, the provisions in the bill are what we believe unduly burdensome or in some instances wholly impossible to comply with based on how the bill is presently written. Very concerning to the chamber and our members are the definitions that I know have already been discussed, and I appreciate the acknowledgement from the chair of emergency, essential worker, and essential employee. We have come to learn, and we very much appreciate that it isn't necessarily the intent of the bill, but of the bill sponsors, but as drafted, the definitions are very broad, sometimes ambiguous, and go well beyond the scope of the public health emergency we're currently navigating. For example, as presently drafted, emergency could be defined as our most recent snowstorm under the language that addresses environmental degradation. We also believe that the definitions of essential worker and essential employer are very broad and not tied necessarily to any risk categorization or methodology. The bottom line, and I want to end with this, is that throughout the pandemic, the chamber and our members have remained steadfastly committed to doing our part to mitigate the impact of the pandemic. I don't have a member that I can identify who doesn't put the health and safety of their employees, their customers, and the general public as their top priority, working tirelessly to reduce risk of exposure in a constantly evolving threat environment that's often filled with incomplete or inconsistent information. This is not to say that bad actors don't exist or that they should not be held accountable. However, we strongly believe that this legislation is not the way in which to do that and will result in many unintended consequences for both Maryland job creators and their employees. I also want to acknowledge that over the course of the last 2 weeks, we've heard from thousands of businesses and business owners from across the state regarding their concerns over this bill, more than any other issue or legislation that we're working this session. So for these reasons, and based on the comprehensive list of concerns in each section of the bill that we've outlined in our written testimony, the chamber respectfully requests an unfavorable report on House Bill 581.
Thank you. Michael Halloran.
Thank you, Mr. Chairman, and good afternoon, members of the House Economic Matters Committee. For the record, Mike O'Halloran here on behalf of NFIB Maryland. We've heard the comptroller say that in his office's estimation, 30,000 small businesses closed permanently as a result of the pandemic last year. So obviously this pandemic has had a disproportionately devastating impact on our state's small businesses compared to their neighbors and larger firms. A recent survey of small business owners released this week said that nearly a third of small businesses say that they will have to close their doors permanently if economic conditions don't improve dramatically over this year. Most of them say they don't expect those conditions to improve until sometime in 2022. That's where we're at now, with a global pandemic still raging. So if we look at HB 581, putting costly mandates on our state's job creators, there is absolutely no way that a small business can make this work. If we were to have HB 581 as the law of the land right now, meaning $3 extra an hour in hazard pay, with 2.5 work weeks of paid leave, plus the full week of paid sick and safe leave that is already the law of the land, plus the minimum wage that just went up on the first of the year, all of this makes this bill financially impossible for our state's smallest businesses. Look, we are all doing everything that we can to protect ourselves and our loved ones. That goes for small business owners and workers alike. We are all in this together, as we've heard our state's leaders, indeed many of you, say to your constituents. Employers are overwhelmingly taking steps to protect their workers, oftentimes going above and beyond government guidelines. Things like at our restaurants, changing menus to digital menus, folks taking extra time and extra precaution to clean highly touched work areas over and over again throughout the day. These and other health guidelines that are ever changing from week to week, if not day by day, are the sorts of measures that small business owners are taking to ensure the safety of themselves, their employees, their customers, and clients. Our members respect and acknowledge the suffering of witnesses today. They share the same stories, and that is why they are doing everything that they possibly and financially can to protect themselves, because without a job, employees can't take sick leave. They are trying to protect themselves, but HB 581's one-size-fits-all approach to an emergency like this just does not work for Maryland small businesses. We appreciate the sentiment of the bill sponsor, but at this point, as the bill is introduced, we respectfully request an unfavorable report.
Thank you. Melvin Thompson.
Thank you very much, Mr. Chairman. Members of the committee, I'm Melvin Thompson on behalf of the Restaurant Association of Maryland, and we oppose this legislation if it's intended to apply to restaurants and the food service employers. And I say that because according to the bill language, this legislation applies only to the essential employers in the specified industries and sectors, and appears to closely follow the critical infrastructure sectors of the Federal Cybersecurity and Infrastructure Security Agency, commonly known as CISA. Restaurants are included as part of the CISA food and agriculture sector, and this sector is included in this legislation. However, restaurants are not mentioned in the specific industry list in this bill. So if restaurants are intended to be included, we would oppose this legislation because of the additional burden it would place on the struggling restaurant industry as we try to recover from the catastrophic impact of the COVID pandemic. Subjecting restaurant employers to the additional financial burdens proposed in this legislation could drive many out of business or force them to close their businesses during declared emergencies. Hazard pay and the other essential worker benefits proposed would be difficult for restaurant employers to absorb, given our industry's narrow profit margin and customers' aversion to price increases. And these additional burdens would be on top of higher labor costs associated with Maryland's sick and safe leave law and the annual minimum wage increases phased in through 2026. And if this bill were to pass and apply to restaurants now, during the current COVID emergency, most restaurants would not be able to afford compliance because of the government-imposed operating restrictions that have significantly reduced their revenues and have put many on the brink of permanent closure. For these reasons, we oppose this legislation as it's currently drafted. Thank you very much.
Delegate Charkoudian.
Thank you, Mr. Chair. I think this question is for Mr. O'Halloran, although possibly for others. So as I read this legislation, and I appreciate that it's not perfect, and I definitely heard the chairman talk about his openness to engaging in process for improvement. So I also appreciate Ms. Locklear's comments and potentially they set up our ability to move this legislation with some adjustments. But Mr. O'Halloran, I guess my question is that you're using the term broadly of small businesses. And I would agree, and I would agree with a lot of Mr. Thompson's comments that there's many small businesses that are really struggling right now, but those businesses are struggling because they were forced to reduce capacity. They were forced to close, to only serve outside, to reduce capacity at 25%. So in my understanding of this legislation, those are not the essential employees that we're talking about. We're talking about the folks who had to stay open. And so that would be the grocery stores who had record profits. That would be the hospitals who continued in operations. That's the transit. So I guess I just am wondering, in your head, is it a technical issue in the bill, or is it your understanding that this somehow is also like a restaurants or other small businesses that were sort of forced into closure? I'm confused by that language because it seems like it's inconsistent with what I see the bill to be about.
Sure. I mean, well, look, as you probably know, NFIB members represent every industry and sector you can possibly imagine, from small locally owned grocery stores to family farms to small manufacturers. I mean, we run the gamut. And, you know, as you also know, if you look at the bill, there are 5 full pages, give or take, of what constitutes an essential employer. So if you're wondering, you know, does this really impact small businesses, or rather, are small businesses really a quote unquote essential employer? Absolutely they are. And you know, in our members' opinion, they have every right to be concerned about the cost implications associated with it. Because at the end of the day, I mean, as the chair pointed out in his opening remarks, you know, let's say the sine die is April 8th, somewhere in there. And if the legislature were to pass this bill, again, notwithstanding any changes made to the bill, but pass this bill as we have it in front of us today, the very next day, those very small businesses that are so concerned about the cost implications are immediately on the hook for the $3 an hour, for the 2.5 weeks in additional paid leave. So these are serious concerns.
Right. No, I appreciate that. And I appreciate that there are small businesses that would be affected by this. But I guess what I'm asking is, when we're saying small businesses generally, there's a whole category of small businesses, as I understand it, that are struggling. And a lot of their struggle is tied to the fact that they had to reduce the way that or change the way that they normally operate. So restaurants and bars, retail stores that were non-essential, and so on. Then there's another category of businesses, and grocery stores, I think, is really what falls there, which had to continue to operate, which is what we consider to be essential. And I think the way that the pandemic played out for each of those 2 categories, and there's small businesses and large businesses in both, but the way the pandemic played out for each of those 2 categories of businesses is very different. And I'm just wondering if that's also your understanding of it.
Yeah, I mean, I said as much in my comments, maybe not directly, but certainly alluded to it, that saying, you know, this pandemic has disproportionately impacted small businesses, as, you know, compared to larger firms. I
guess what I'm asking about is the distinction within the small businesses, that the small businesses that we all had to rely on, right? Grocery stores, small and large, record profits. Not to say they didn't struggle, not to say they didn't have to adjust for things, but they did quite well compared to, for example, a small bar, which really is struggling in a different way, but isn't an essential business. And so that's where I'm just trying to make sure we're clear about the distinction, because when we say small business, it's such a large category. And I would hate for us to be confused and think that somehow the things that we're doing in this bill that would protect workers in grocery stores, for example, would also apply in a bar that is not essential and has struggled in a different way than grocery stores have. And I'm just wondering if you would agree that there is a distinction in the sets of folks of kinds of businesses that we're talking about.
Sure, I mean, but unfortunately, I mean, you know, the way the bill is written, you know, there is no, frankly, distinction. I mean, like I said, there's over 5 pages of what constitutes an essential employer. And in our members' estimation, that's the better question is to ask, well, who is not included? So regardless of whether it's big or small, or it's a grocery store, or it's a bar, or who's been impacted, you know, I guess we agree in that sense that yes, this pandemic has impacted businesses differently, whether it's whether by industry or by size.
Right. So I guess I'm thinking that if we were to, by definition, the essential ones are the ones that had to stay open. So they did better than the ones that closed or were shut down to 25% or 50% at different times. And so maybe it's a matter of just doing some more work in that definition. You think you might support this if we did some more work in clarifying and defining?
Oh, I don't know. I can't say from my members' perspective whether or not they support anything at this point. I mean, again, just based on this bill and even some of the proponents' testimony, we're hearing from proponents that say this bill doesn't go far enough.
Okay, thank you, Mr. Chair.
Delegate Howard.
Thank you, Mr. Chair. First, Delegate Adams had a question earlier. I don't think we saw his hand up. So we might want to circle back around to him. I know he had a question, had his hand up. But also too, I mean, Mike, in the first 10 seconds when, we hear these things like, oh, well, they had record profits. The grocery stores had record profits. 2 miles from my house is Mohan Grover's grocery store that directly serves the community. He might have had record profits for that small amount of time. I guess my question is that that's a real misnomer in that it's easy to think about that when you think about the multi-billion-dollar corporations like Giant, right? Okay, but that's not always the case. A quarter mile from my house, there's a privately owned small hardware store. A mile from that is another privately owned small hardware store, all essential businesses. And they might have had record profits for like 3 months. But is there any economic indicator that you're seeing from the NFIB's perspective that all of these businesses aren't going to have problems digging out of this, regardless of the short-term spike in sales that some might have seen?
Sure. Well, I think there's two things to keep in mind. When there's talk about record profits, we're talking about record profits for publicly traded companies, for shareholders, which, those record profits ebb and flow as the stock market does. But to your point about independent, grocery stores like Mohan's or Grawl's here in Annapolis, we also must keep in mind that there's an executive order in place that, for lack of a better way of explaining it, kind of caps any sort of profit that not just a retailer, but I believe any business can take in. Because, we are cognizant of, the sorts of things that are going on right now. And as anybody on our side of this issue will attest to, there are bad actors. And that is why things like, a cap on how much a retailer or business person can upcharge or make. So.
Okay, your question?
That did it, Mr. Chair. Thank you.
Delegate Adams.
Mr. Chair, thank you. Briefly, I was going to ask this of the Attorney General, but Mike, I'll just ask you because it's a easy answer. The Attorney General said we need to get folks back to work, and this might increase costs. Isn't NFIB's position on this that we're worried that this bill will put your members out of business?
Absolutely. I mean, look, the federal PPP program was essentially a lifeline for so many small businesses that were struggling to hang on. So much so that they've already exhausted the PPP loans, the original round. They've already asked for those loans to be forgiveness. And now the federal government, understanding how struggling small businesses really are, how much they are struggling right now, has opened up a second round of PPP. So again, House Bill 581 to add these costs in, and I'm also cognizant of the fact that we are talking about this particular pandemic, and by the chair's own recognition, his idea is to have it, this bill impact or apply to pandemics like this. Well, here we are, and these sorts of costs, again, $3 in hazard pay, 2.5 work weeks in paid leave, the associated costs with providing PPE, of which, I think reasonably we think, okay, PPE for, let's say, a grocery store worker, gloves and a mask perhaps. But unfortunately, the bill, it all comes down to what's in the bill, right? What the legislative language is. Can the argument be made by proponents? Well, a mask and gloves, that doesn't go far enough.
Yeah,
so now they're on the hook. So
yeah, so Mike, all I'm saying is the Attorney General wants people back to work. I think it'd be helpful to have businesses around to employ them. Thank you.
Absolutely.
All right, guys, I'm going to take 2 more questions. Delegate Aarons, Delegate Mouts, and then we're going to get back to witness list. Delegate.
Mr. Chair, I apologize. I was offline for a little bit here. Mike, I wanted to address something with you real quick. When you started looking at winners and losers, have you touched on that in your testimony within FIB?
In what sense are you talking about winners and losers? Like,
well, I guess Well, I'll open up a little bit. When I look at the scope of the bill and I start thinking that we have a quote unquote executive decision made, and how this pandemic has demonstrated to us that my county, for instance, in Queen Anne's County, we were very low in breakout and it needs to be treated across the board. The winners and losers in that, not one size fits all.
Yeah, look, the economic impacts of this pandemic are varied so greatly, not only in geographical location, but also by industry and by the size of the business. So that's why I close with this one size fits all mandate that's enshrined in HB 581 doesn't take into account the very nature of the economic crisis that we're facing right now. It's impacting everybody. Delegate Charkoudian, as you mentioned, bars and taverns are getting slammed right now. But for whatever reason, perhaps home improvement contractors are able to face this a little bit better because everybody's that set aside money to do vacation is now putting new carpeting down or new flooring down. So it's so varied and so broad, and that's why it's problematic, such a one size fits all. But regardless of that, the costs are still there, and the costs are still very concerning.
Okay, thank you, Mr. Chair.
Delegate Mounts.
Thank you, Chairman. And I was kind of surprised by the testimony. My experience in working with different businesses and individuals through this past year, there was a constant question about what is safe, what is not safe. And I didn't hear any of the witnesses talk about the amount of information or lack of information that they were getting from either their local health officer or the state. We're talking about workplace safety, and if there isn't a standard and there isn't direction on what is a safe workplace, I didn't know if that was something that you all had thought about, or I didn't hear about it, and I just thought I'd ask you if you thought that would be an element that should be considered if we're looking at workplace safety and state of emergencies, particularly with the pandemic.
Delegate Mounts, if I may answer that a little bit, I did touch on that in my testimony, because the bill does go into creating protocols and emergency preparedness plans that would have to be in place by a business. And both you and I know you own a business. That is not your expertise. That's where MEMA or the Department of Health or the CDC provides that guidance that we should be following. We are not health experts. And so there has been a bit of guidance, but you're absolutely correct. And in this bill, it's saying that the employer has to create something like that. And that just doesn't belong with an employer.
As a delegate, I was in a bad situation because I had businesses coming to me asking me for advice on what was the health protocol. And I was using information, the best information that I had that was available. But when I went to the authorities, all the information I was getting was off the record. And
if you recall, the governor had created numerous advisory groups. So I had an opportunity to lead the retail and tourism advisory groups, and we put our recommendations out publicly to help businesses. But none of that was really ever adopted or something like that. It was just out there to provide guidance.
Thank you. I'll take another look at the protocol section. Thank you.
Right. Amy Rohrer.
Good afternoon, Mr. Chairman and members of the committee. My name is Amy Rohrer, here on behalf of the Maryland Hotel Lodging Association, opposed to House Bill 581. Being in hospitality, we very much rely on our employees. We need them safe and healthy, and it is in our own best interest to do everything within reason, as recommended by the CDC, to protect both our employees and our guests. You have my written testimony outlining our specific concerns, and I'd like to focus my comments on two things. First, the economic impact of COVID on hotels. When stay-at-home orders were issued, hotels were deemed essential, but that does not mean we thrive. Owners had to decide if it made more sense to stay open, knowing they would be operating at a loss given the business that had dried up, or if it made more sense to close, which would still mean losing money, but potentially less than remaining open. These were difficult decisions to make, but every owner did what they thought was best in the long run for their business and for their employees. Many hotels closed in March and some have not reopened to this day. And I cannot emphasize enough, 1 year into this pandemic, hotels are barely surviving. Average occupancy in Maryland was 43% in 2020, which is below the threshold at which hotels can break even operationally, let alone pay debt. On page 4 of my written testimony, there is data on sales tax collection comparing April through November of 2020 versus 2019. It shows sales tax attributable to full service hotels down 64%. Every segment of tourism is down, but full service hotels have been hit harder than any other segment. As a result, we have already had to eliminate 10,000 positions in Maryland. As of December, the unemployment rate in the accommodation sector is 18.9%. Despite these challenges, I want to move on to my second point, which is the changes the industry has made in light of COVID. Early on in the pandemic, the American Hotel and Lodging Association launched the Safe Stay Initiative, which is a common set of standards that was developed with help from outside experts in cleaning and reviewed by the CDC. These standards have been broadly endorsed by hospitality leaders in all 50 states, including Maryland. I'm running short on time, but would be happy to answer questions related to those standards, and there is a link with more details in my testimony. Suffice it to say, the industry has taken all recommended and reasonable steps to protect our employees and guests, while also working very hard to stay in business. We cannot afford additional costs beyond what we have done at this time. I'd like to also note we are very eager for employees to be vaccinated, but the fact that hotel workers who are essential are not in phase 1A, B, or C for vaccination phases, and it's not even clear if we are in phase 2, leads me to think that the Maryland Health Department has not identified us as being high risk, and the steps we have taken appear to be effective. We urge you to reject this legislation and prevent further job loss and hotel closures. The economic implications would cause immense harm to our industry and slow down economic recovery for the state. So we respectfully ask for an unfavorable report. Thank you.
Thank you. Peter Kitzmiller.
Mr. Chairman.
Sir.
Members of the committee, Peter Kitzmiller, I'm president of the Maryland Automobile Dealers Association. We represent 300 franchised new car and truck dealers across the state of Maryland. Here today in opposition to House Bill 581. I do appreciate the preliminary comments of the chairman. This is a very serious issue. Certainly as an essential business, there's responsibility comes with that. I can talk about the new car and truck dealership industry as an essential business that has to deal with the general public on a daily basis. And since May of 2020, when we've gotten involved in this, the only way for us to stay open and remain effective is to create a safe workplace environment for our employees and our customers. It's not optional. No one's going to come into a car dealership, to the service department, sales department, if there's not distancing protocols in place. PPE equipment is not worn by every employee and offered to every customer. Testing has to be in place. Notification has to be in place. It's not optional. Certainly, I believe very strongly that my dealers care greatly about their customers and their employees. But even if they did not having those things in place would mean we would not be in business much longer. And everybody's talking about the costs, and I'm not going to go into that. But I do want to talk specifically about our industry. And we've talked about winners or losers and record profits, et cetera. Our industry, frankly, has done dramatically better than I ever would have imagined back in May of 2020. But at the end of the year, we are down 15% new car sales in Maryland, which is a little bit better than actually the national average. And our costs to do the things we just talked about, the protocols, the PPE equipment, the plexiglass, all those things have increased significantly. In our industry, we are not able to pass those costs on to our customers. It's just not possible. It's such a competitive market that those costs have to be absorbed. And I'm not complaining about that. We've been allowed to remain open. We've been very fortunate in that circumstance. But these additional costs are just not sustainable. I'm not going to sit here and tell people that we're going to go out of business, but I can say a dealership with this bill in place that at 100 employees is going to have to figure out some way to get by with 35. And that means we're not taking care of our customers the way that we ought to be. I do think the comments about coming up with standards are very, very critical. The retailers made a very good point. We're business people. We are not health professionals, and we've been flying pretty blind since this thing started. I think we've done a pretty good job, but I think it would be beneficial to everyone if we could come up with some very strong standards and not get anecdotal advice, which is what we've been dealing with. With that, I would ask for an unfavorable report, and would happy to answer any questions.
Thank you, Peter. Vinay Sharma.
Good afternoon, Mr. Chairman and respected delegates. My name is Vinay Sharma. I'm Vice President and in-house counsel for Baywood Hotels. We operate hotels in Maryland. I am here in opposition to House Bill 581. Given my background as an attorney, I elected to focus my testimony on something slightly different. I'm going to focus on the legal and constitutional issues with the bill, and more precisely, the retroactive hazard pay. This provision of the bill is ripe for state and federal constitutional challenges. In the federal context, retroactive or ex post facto bills have been controversial since colonial times. James Madison, George Mason wrote extensively against them. Article 1, Section 9 of the U.S. Constitution has a specific prohibition against ex post facto laws. This has later been read to apply exclusively to criminal statutes, but nonetheless, civil ex post facto laws, like the retroactive hazard pay and House Bill 581, are still subject to constitutional challenges. More specifically, this bill, House Bill 581, violates businesses' procedural due process and substantive due process rights. Now, this kind of challenge is subject to a rational basis review, which is generally a low standard. The state just has to show that the law has a rational relationship to this goal. However, this provision of the bill, the retroactive hazard pay, doesn't even cross that bar. The way businesses show that is by showing that it's arbitrary. I think that's been talked to ad nauseum, but I think we can agree that a healthcare worker that doesn't have PPE in a COVID unit doesn't suffer the same risk that a hotel worker might have behind plexiglass with appropriate PPE. And to just say that, well, retroactively, all of them get $3 an hour increase just shows how arbitrary it is. It's also worth noting that the federal courts and the Supreme Court has ruled that bills passed subject to state police powers that are excessively harsh and oppressive may violate due process. I think like in our industry in hospitality, you will see hotels shut down if they have to pay retroactive hazard pay. The state bar, the state constitutional challenges are perhaps even stronger. The Maryland State Constitution in Article 17 of the Maryland Declaration of Rights does have a similar prohibition on ex post facto laws. However, that has been interpreted to be that ex post facto laws are unconstitutional under the Maryland State Constitution, where they abridge a vested right, no matter how rational. I'll direct your attention to a case, Cooper v. Wicomico County from the 1970s. That law involved a statute that retroactively increased Maryland workers' compensation awards to account for inflation. The Maryland Court of Appeals found that law to be unconstitutional. I know this was very brief. These are sort of complicated issues, but I think it's important. I do hope that this testimony is helpful in a negative report from this committee. Thank you.
Thank you. Kurt McCauley. I'll come back to you, Delegate Charkoudian.
Good afternoon. Am I being heard?
Yes, sir.
Oh, sorry. Chairman Davis, members of the Economic Matters Committee. Name is Kurt McCauley, and I represent service stations, convenience stores, and repair facilities in Maryland. And all of my businesses that are members are essential businesses. I have the same concerns that Mike and Kaylee and Ashley and Peter had with the bill, but I have a little bit more of a concern. With the bill the way it's written, $3 an hour and all of the leave and so forth that goes with it. We can't raise our prices. Maryland has a gouging law. What price is on the street, they can't raise it unless the price of that fuel is raised to them. Our businesses in the first 3 months of this pandemic were off 80%, but most of them stayed open. Most of them paid their employees. They're still 25 to 30% off right now. Some of them a little more, some of them a little less. this bill is not workable for a small business with a payroll that's right on the border of breaking right now. What's going to end up is we're going to have businesses that are going bankrupt, out of business, or the owner is going to be working the whole place by himself. At repair shops, you know, when you only have, when you're 80% off of traffic, you don't have cars coming in because they're not driving. You don't sell gasoline, and you don't have repair work. So it's been really hard on our businesses, even though they're essential, even though they're open. They're open, barely making a profit, if at all. So we would appreciate an unfavorable vote with this bill. Thank you.
Delegate Charkoudian.
Thank you, Mr. Chair. I had a clarification for the gentleman who spoke before the Mr. Macaulay. And I'm sorry, I forgot his name now, but Mr. Sharma, is that right?
That's correct.
Thank you. Yeah, I'm confused because I thought was your testimony that you understand this to require retroactive hazard pay?
Yes, the language as drafted, it's our understanding that that's what the legislation requires as drafted.
Okay, that's not my understanding, and the fiscal note suggests that that's not the case. It says specifically, actually, in the summary that it is only prospective. I think that's right. And in section 2, it says this act shall be construed to apply only prospectively and may not be applied or interpreted to require the payment of hazard pay for work performed in an emergency before the effective date of this act. Does that take care of your concern?
I would obviously like to look at it with my colleagues again, but if there is no retroactive pay, then I suppose my testimony is moot.
Okay, great. Thank you so much.
All right. Got a couple more people and then we'll switch back to some proponents. Bruce Bariano.
Hello, Mr. Chairman, and Madam Vice Chair and members of the House Economic Matters Committee. I'm here on behalf of the Maryland Self-Storage Association in opposition to page 5, line 11 of this bill. According to the presentation, Mr. Chairman, respectfully, this bill is about essential workers and essential industry. Self-storage facilities, while they're important in our lives, they're not essential related to the COVID-19 pandemic situation. Self-storage facilities are just what the name says. They are self-storage. At most, we have one employee at the premises in the office to sell periodically any package material or a cart or something of that nature. Other than that, there are no employees on the premises. The individuals coming in and out of the facility are renters of the spaces. We don't even know who's coming in or out. They have keys, they have codes to the locks. And if they bring a family member or a friend to help them either move stuff in or move it out, they're certainly not employees and we do not know about them. So respectfully, I don't know why we're in this bill. If one has an accurate understanding of this business, we don't belong in this bill. We don't have employees but one, and it's self-service. And while I respect enormously and I'm very proud to represent my client in terms of what we've been talking about, and I think the thrust and the purpose, if I understand it, of the bill, it's not an essential industry, and that one person is not an essential worker as it relates to COVID-19 in terms of the effect of it or anything of that nature. So I would urgently ask on behalf of my client to please just remove us from the bill. We don't belong in there, and be happy to answer any questions that you may have.
Thank you very much.
Thank you,
Joseph Doherty. Is Mr. Doherty with us? If he is, he's muted. All right, let me move on to, is it Preeti Patel?
Good afternoon, Chairman Davis and members of the committee. Thank you for the opportunity to testify today. My name is Preeti Patel, and I'm the owner of the Holiday Inn Express in Annapolis, Maryland. I'm also the ambassador for the Asian American Hotel Owners Association, AHOA, representing 212 hotel owners in the state of Maryland. If they could all testify today, you would hear a similar story to mine. I, along with my fellow hoteliers, strongly oppose HB 581. This bill will be detrimental to our industry, which is already in dire straits. My hotel, like so many others, is a family business. And to say that we have been hit hard during this pandemic is an understatement. Since last March, we have had to alter the way we run our hotel and endure the financial strains that ensued. Even though hotel guests were hardly walking through our doors, we went above and beyond even the CDC guidelines to keep our guests and employees safe. With minimal revenue coming in, we took the extra steps to install UVC light filters, purchase electrostatic sprayers, install plexiglass dividers, update signage, provide masks and other PPE. We even altered the way we were taking care of our guests with housekeeping and other issues. We made our employees and guests our first priority. We've even provided meals and boxes of groceries to our employees and guests if they needed it. All through this pandemic, numerous Maryland hotels provided rooms to first responders and even some of the homeless community, so they had a safe place to go. This bill essentially penalizes some of those good deeds and will just kick us while we're down. We've had to spend long hours negotiating for financial leniency with our franchisor, banks, vendors, utility companies, and others to barely just keep the lights on. The hardest part was figuring out who we could still keep employed and who to let go in such a precarious time. In a small business, employees are our family too. I question how I may have to tell my son one day, who is a hospitality major and graduating soon, that there may not be a family business for him to come run, a business that we've had for 21 years. Maryland hoteliers are facing economic challenges of historic record. The stimulus provided to our industry by the federal government was a short lifeline, and we've been able to survive, but barely. Our industry will be the last to recover. 2023 is the projection for now. According to the American Hotel Lodging Association, pre-COVID, the Maryland hotel industry supported 52,644 jobs, paid an estimated $2 billion in wages and salaries, and paid an estimated $602 million in state and local taxes. The loss of this revenue to the state will also have a trickle-down effect on numerous related industries. HB 581 will force businesses to stop hiring, reduce their workforce, and even shut their doors. We simply cannot be forced to meet additional cost increases. HB 581 will derail any hopes of Maryland hoteliers recovering their losses and will deflate the livelihood of so many. I urge you to give an unfavorable report to this bill and let there be a business for families to run. Thank you for your time.
Thank you. Denise Gilmore.
Thank you, Mr. Chairman, Vice Chair, and members of the committee. My name is Denise Gilmore, and I'm a field director with AFSCME Council 3. We represent 30,000 state and higher education employees across Maryland. You heard from two of our members earlier, Mr. Winton Johnson and Ms. Ikea Cornish, who have been on the front lines daily during this pandemic and are reporting very different experiences at work. This is typical of what we've observed of the state's response. With no central authority guiding the minimum protections employees should have, the implementation and enforcement of safety protocols during this pandemic has been inconsistent at best and non-existent at some of our worst work sites. We represent over 1,000 individual work sites in the state. Many of our members are still having difficulty accessing appropriate PPE, getting timely notifications of potential exposures, and getting social distancing orders enforced in their workplace. Despite very little guidance coming from the top down, we're incredibly proud of the work our members have done this pandemic to try and prevent their facilities and offices from becoming vectors for the spread of the virus back into their communities. Our members have been reporting daily to correctional facilities, state hospitals, and juvenile facilities. They've been in our courthouses and on our college campuses. They've been in our communities investigating child abuse, visiting and monitoring sex offenders, and assisting motorists on our highways. They do this work in the spirit of service, despite not making very much money. As Winton noted, the hazard pay policy that the state extended unfairly leaves many workers out who are risking their lives to serve the public. We know that any additional money we give our members, they spend right here in our communities, in small businesses in their neighborhoods. They're worth it. And as IKEA testified, our continued success in preventing outbreaks that spread back into the communities is contingent on our members having access to additional paid pandemic leave, so that as they quarantine for the second, third, and fourth time, they can do so without losing all of their earned leave or go unpaid. Thousands of state employees have contracted COVID-19, and sadly, 9 of our members have lost their lives to this terrible virus. We can prevent more deaths and infections from occurring. We thank Chairman Davis for introducing this important and comprehensive workplace safety legislation. We ask the committee to please provide a favorable report on HB 581. Thank you.
Thank you. Letitia Howard.
Yes, good afternoon. My name is Letitia Howard. I am a registered nurse. I've been a nurse for 20 years. The last 12 years is at Prince George's Hospital Center in Cheverly, Maryland. I work on the trauma, surgical, orthopedic unit there. And of course, my testimony is when the coronavirus hit, of course, it was really extremely frightening. We did not have proper PPE or enough gowns or masks, and we still struggle with that. Even the masks that were meant for one-time use, we're keeping for a week or more. And you can only imagine wearing that 12, 13, 14 hours a day, because that's my shift. You know, we still did our jobs, but after we lost our first employee, really what really kept us together, honestly, for me, was my faith. We did a lot of praying at work before shift started. So that really, really helped to relieve our mental stress, but there's still a lot of stress. I'm seeing more call outs with my colleagues. Of course, they have child care issues. And also people feel, you know, to be supported that we should have hazard pay. I've lost some colleagues at my institution that have gone out of state or somewhere else because they are offering hazard pay, because people feel like, okay, the probability of me getting infected is extremely high. My family is high. At least I can be compensated, you know, for putting myself out there in my service. Personally, myself, I was on quarantine because I was exposed, and it was without pay because my sick leave was finished. So we're really, really asking for support of this bill of HB 581 for leave when we're out, you know, because of exposure, and for hazard pay. So thank you so much for your support.
Thank you. Laura Raskin? I'll come to the questions in a minute, guys. Is Lauren Raskin with us? All right, let me go to Delegate Crosby, then Delegate Aarons.
Thank you, Mr. Chair. My question real quick, ma'am, who testified last, I apologize. I think it was Letitia. Thank you for your testimony. Thank you for your testimony. Just real quick, you said former coworkers went to a different location that received hazard pay. Was that in a job, or is there a surrounding state that has passed this? Maybe I missed that.
Some facilities are doing better. It's not standard. So some facilities
Okay.
are offering very good hazard pay. It's both. And then also some are leaving and going out of state to take the nursing contracts temporary, because I'm a registered nurse, and even our patient care technicians, assistants. They're going out of state because other states are offering very good hazard pay. So yeah, I've seen both. One
Okay.
local hospital is doing very well. So we have lost some employees.
Got you. So basically, if another hospital has a shortage, the way I understand this, and my mom's a nurse, so I may be incorrect, but
Mhm.
it would almost be like doing a travel nurse program in the sense that if you have a shortage in, let's say, Wisconsin, and they're in dire need for nurses, then they would offer hazard pay, A, for the risk, but B, to try to lure employees or nurses to come work there to fill that shortage. Am I understanding that correctly?
Some is shortage and some are just hazard pay.
Okay.
Because we're all a short, to be
Okay.
honest with you. Yeah.
Thank you.
Yeah, we all have needs. I would hardly say there are any facilities that don't have needs, because, for example, you have a COVID unit, and that staff needs to have a less amount of patients. Okay. And the non-COVID units are really getting hit because they're overloaded because, of course, I mean, things are still happening. And I mean, you have regular patients. And so those units are overloaded. So for example, that particular area, they're short,
Okay.
so it just,
Thank
yeah.
you. Thank you so much.
You're welcome. Thanks.
Delegate Aaron's.
Thank you, Mr. Chair. Ms. Howard, just two
Yes, sir.
points. Thank you very much for your service, and I do appreciate it. I'm sorry you had COVID, and I wish you well. But I guess on the thing about hazard pay going to another job and all that stuff, I think that's more a business decision by the hospitals and stuff, and I understand that because we deal with that in locally with some doctors and our physicians. But I had a question for you on the scope of this bill, and something that I think is kind of unclear to me. I speak to my health officers, and they talk about healthcare workers, first responders. There's been an abnormal number of them that do not want to take the vaccine. And by this, I think this bill opens this up somewhat, that should the government enforce this and sit back and tell you, meaning the state tells you that we have to, the small businesses and businesses have to pay this, are you afraid that they may insist that these healthcare workers take that vaccine or not get to pay?
No, no, I'm not afraid of that. Most healthcare workers, a lot are taking it. For example, we have to take the flu shot. So I don't know what the future holds if they're going to do that.
Well, okay, I'm speaking specifically from a health officer saying that he's had upwards of 20% of our first responders, nurses or whatever, will not take that vaccine. And I think this bill will open that up somewhat to saying that at some point, I worry about this type of legislation. And you're saying you have to take it by law, or you have to take it per your company or your hospital?
It's no, we're not forced to take it right now. We're not.
Are you afraid of this happening?
Say it again, sir. I'm sorry.
Would you support the government telling you have to take this as a condition of employment?
No, because I believe that you should have a choice.
But do you believe that? I mean, I understand that. And I think that's an important point that we're missing here.
Yeah.
Okay. But thank you very much. I appreciate it again. Thank you.
Thank you very much.
Thank you. Delegate Crosby, was your hand up from the previous question? Okay.
All right. I'm the worst at lowering it.
No problem. I just wanted to make sure I didn't ignore you. Jake Burdett.
Hey, can everybody hear me?
Yes.
Okay. Thank you to Chairman Davis and the members of the House Economic Matters Committee for the opportunity to testify to you all today in favor of HB 081, the Maryland Essential Workers Protection Act. My name is Jake Burdett, and while I'm the president of the Columbia Democratic Club in Howard County, as well as a member of the indivisible Howard County Economic Equity Team, both of which do support this bill, I'm here today to speak more from my perspective as a current Amazon warehouse worker. When most people hear the phrase essential frontline workers, they tend to picture medical professionals or grocery store workers. While both of these jobs are vital to keeping society functioning during a pandemic, people often forget about warehouse workers who serve just as important of a role in keeping the economy and society running and are also put in grave danger simply by showing up for work. At my Amazon warehouse in Baltimore, I work most shifts with 230 other frontline workers, all crammed together in one single building. So it's no wonder why we get a notification about once a week of a new coworker getting COVID. None of us want to be in an area with hundreds of other people during a deadly viral outbreak. We have to be because our job requires us to be. Most of us either don't have the opportunity to find employment elsewhere that would allow us to work from home, or we don't have enough money saved up to quit until the pandemic ends. So just not going to work is not an option. Yes, for me and my coworkers, several times a week, we have to decide between going into work and putting ourselves at extreme risk of catching COVID in our warehouse, or staying home to stay healthy, but then missing out on being able to put food on the table. We essentially have to trade our economic security for our health. While much of the economy is struggling during COVID and many businesses have been forced to close down, it's actually been quite the opposite for Amazon. Business has been booming. With more people afraid to shop in person now because of COVID, online shopping on Amazon has been higher than ever. And despite massive profits in large part due to the circumstances COVID has created, Amazon has still opted not to pay their employees hazard pay. Amazon did pay their employees hazard pay at the beginning of the crisis in March and April of 2020, but the pandemic has only gotten much worse since then, yet Amazon has opted not to continue paying their employees hazard pay. Although Jeff Bezos recently left his role as Amazon CEO, he is still executive chairman, and in the 3 minutes I have to give this testimony, Jeff Bezos will make over $450,000, so Amazon can definitely afford the hazard pay. While I'm speaking from my personal experience as an Amazon warehouse worker, this is just as true for all essential workers. If essential workers truly are essential, we need to start paying them hazard pay like they are. Please support HB 0581 with mandatory $3 an hour hazard pay included. Thank you very much.
Michael Wilson.
Good afternoon. Thank you, Chairman Davis and members of the House Economic Matters Committee. Appreciate the chance to share testimony this afternoon on behalf of our over 10,000 UFCW Local 400 members in Maryland, working on the front lines of the ongoing pandemic in grocery, retail, food distribution, law enforcement, and healthcare. I definitely appreciate the testimony of the previous person who works in Amazon warehouse, and you'll be hearing from a member of ours later today as well. We strongly support HB 581 and urge you to vote it favorably today. At the beginning of this pandemic, our members were told they were heroes and essential. Many employers put in place additional safety measures, and some even agreed to hazard or hero pay, both to show appreciation for the risks our members were taking by going to work, but also because many of them were seeing unprecedented increases in revenue and profits. Unfortunately, as time has gone on, employers have scaled back or eliminated additional pay and instead used the profits they're making while our members and others continue to put themselves at risk to buy back shares, reward executives, and invest in capital and technology. Many have also scaled back their safety policies and the enforcement of policies they still claim to have in place. It has become clear that many of them would rather make a sale than keep employees and customers safe by enforcing basic measures like social distancing and reasonable caps on the number of customers and employees in a store. When employers will not do the right thing, we need to compel them to act. This bill puts in place some common sense minimum standards to protect workers who have always been essential but did not sign up to be sacrificial. Among Local 400 membership alone, we have had 558 members in Maryland diagnosed with COVID-19 and 3 pass away. This does not include illnesses and deaths in the many non-union employers in our jurisdiction, which includes Montgomery, Prince George's, Charles, Calvert, and St. Mary's counties, as well as the Annapolis Police Department and Giants Delivery Warehouse in Anne Arundel County. Every aspect of this bill is key to keeping our members as well as their families and communities safe, which with COVID-19 still spreading uncontrolled will save lives. We have been able to work with many of our represented employers on many of these issues, but we need a level playing field, certainty that employers cannot remove protections, and clearly non-union workers deserve these protections as well. When you go to work, it is the responsibility of your employer to provide a safe workplace. Unfortunately, with the lack of guidance and enforcement from both state and federal safety and health agencies, many workers have no recourse if their employer has chosen not to create protocols and provide appropriate PPE or other safety equipment. The requirements in this bill are important for fixing that. I have submitted written testimony which goes into more detail about our support for each provision of this bill, but this pandemic has been impacting all of us for nearly a year now. It is time to take the lessons we have learned and correct the problems that have led this virus to continue to spread uncontrollably and disproportionately impact those of us who cannot work from home. This bill cannot go into effect soon enough for our members and others who have suffered needlessly because some employers have not done the right thing. It can keep people safe and save lives going forward. So we urge you to vote it out favorably as soon as possible. Thank you, Chairman Davis and members of the committee.
Delegate Impalaria. You're muted, Delegate Impalaria.
Thank you, Mr. Wilson. As a member of a union, I keep hearing this common theme that we need to step in as the General Assembly and take the place of the union. Sir, what you were saying that the union has failed you, they haven't been able to go in and negotiate these contracts and correct these problems and, discuss this with your employers and bring you back satisfactory information, that we, the Maryland General Assembly, must step into the union's place and do their job for them. And, maybe going forward, maybe we just shouldn't have unions anymore. We should base the price on what we say, the Maryland General Assembly, rather than the collective bargaining that you guys have. And I can also, a lot of companies are probably worried right now that there might be a new minimum wage, federal minimum wage, and they're reluctant to do anything until they see what happens with that. And I think that holds up movement by private companies. So do you feel that the unions have failed you and haven't brought you to proper solution and represented you properly?
The short answer to that is no, but I think that just to go into detail, I think that what has happened over time, unfortunately, is that due to changes and the sort of whittling away of federal law when it comes to protections for people who are trying to organize unions. And I think the previous speaker from the Amazon warehouse may be able to speak to this even more than I can, because luckily most of our employers do follow federal labor law. I know there's an election at an Amazon warehouse in Alabama coming up where they've done everything they can to keep the union out. I think that unfortunately the density that we've been able to maintain in certain industries has gotten to the point where it's unfortunately not always unions that are setting the standard. And so what needs to happen in a lot of these cases to create a level playing field, we can negotiate what we can negotiate in terms of hazard pay, in terms of increased safety protections. But when the dominant players in the industry aren't going along with those things, it becomes more difficult to stay competitive as a union employer. So I don't think that the blame here rests on what unions are able to negotiate or not to negotiate. I think that it rests on the lack of protections from, unfortunately, federal labor law, which is a different issue. But also it rests on creating a level playing field so that nobody is able to sort of race things to the bottom when it comes to these safety protections and things like hazard pay.
And nobody's against safety protections, but when we talk about, Amazon, obviously they're not union. And Amazon's watching what's going on at the federal level. And they may be ready to give their employees a raise and say, well, wait a minute, let's not do anything. Let's find out what the federal government's going to do before we give that raise, which means those employees at Amazon are not going to get that raise as quick as they might have because of what's going on at the federal level. And it could also be the same with your union. They're waiting for the feds, and they really shouldn't. Your union should not wait. Amazon shouldn't have to wait. The feds shouldn't be interfering with private business. I don't think we should be interfering with private business, especially when it comes to pay, because it's all about competition. And I know that if I own a business and you work for a different business, I'm praying that that company pays you less so I can steal you as an employee and bring you to my company and pay you $2 an hour more. So, I'm sorry that the unions, in my opinion, are failing you. And I'm sorry that intervention of the government is causing unstableness in the amount of money that people are getting paid. You don't have to answer that, but thank you for testifying today.
I appreciate it. And just quickly, I would just say, I think that a lot of this rests on the unfortunate power imbalance that has been created between workers and employers due to federal law. And I think that if those are things that need to be changed, but I think overall, this is not about government taking the place of collective action of workers through labor unions. This is about making sure that when there has been these failures at the federal level to allow workers to come together and have a voice on the job, that workers are taking every opportunity that they have to advocate for themselves and their coworkers, whether that's to their employer or to their elected officials at the government level, to make these kind of changes. So
just real quick, because I don't want to keep going, but we're only here for 90 days, so we can't be on the top of every single issue. So if we said, okay, you're going to get this hazard pay, and then 30 days after we get out here, everybody's got their shots and we don't have to worry about this. And for some reason, Corona has gone away, just like the Spanish flu did, and never comes back. We're not here to reverse that. We'd have to call a special session. So that's why we probably shouldn't be involved in these kind of negotiations. But thank you. And that's it. The committee needs to move on. Thank you.
Delegate Aarons.
Thank you, Mr. Chair, and thank you, Delegate Impair, for shortening my time. Mr. Wilson, just briefly, you're a benefactor of this bill, and I appreciate that. But there's a lot of this bill that concerns me as a legislator and should probably concern you, is that how we pick the winners and losers in this bill, which I think is definitely out there. Myself as a real estate agent, I'm not covered by this bill, yet a car salesman is, and we get paid pretty much on the same. Are you concerned that at some point, let's say you were the gentleman that worked for Amazon or even your business, on how if this executive that's determining this bill, that's actually the all-powering Oz on this, if they come up and decide that you're no longer essential or your business has done enough to take you out of essential, does that bother you that type of power is there?
No, I mean, I think the intent is clear that like what is essential is businesses that pretty much have to stay open or have not been ordered to scale back during the pandemic. And I think, in the grocery retail industry, I think it's been pretty clear that has been an essential business during this.
All right, I get that, but my question is, well, I feel I'm essential. And you're saying you're okay that you feel that way, but I feel this way. And I think when somebody's out there determining that, do you think maybe we could have stronger rules as to who picks these winners and losers?
Well,
that you might not be included in?
I don't know that it's about picking winners and losers because I think
let's stick with my theme. It is, to me, it is. I'm asking you a question if you think my opinion's okay. I think I'm a loser in this. You don't.
Well, I think that, I mean, obviously you're entitled to your opinion. I think that and to a certain extent, like our members who are out there working right now don't necessarily feel like they're winners because they've been declared essential. I mean, they feel like they're being made.
Well, I feel like I'm a loser because I haven't been. And that's what I'm trying to say. Why is it okay for you and not okay for me?
I mean, I think that there's been a lot of things that have gone on during this pandemic that I think you could argue are unfair about who has won and who has lost. I think that a lot of the winners have been Jeff Bezos and the CEOs of these corporations that have been raking in these profits.
Okay, I agree with you that the big businesses, but I'm a small guy, and that's right. My point is, you got my point, I think, and I understand where you want to go with this, but I also have to sit back and say this is a very slippery slope when we have essentially one person, and I don't know who controls that person or what metrics we're going to use moving forward. Those are the types of things I think should concern us all. But thank you for your answers. Thank you, Mr. Chair.
Thank you. Christopher Dews.
Yes, this is Christopher Dews. Can you all hear me?
Yes, sir.
Okay, just checking. My name is Christopher Dews. I'm a policy advocate for the Job Opportunities Task Force. And so we're here speaking in favor of House Bill 581. We support the legislation, just so you know, JOTF, for the record, is a nonprofit that specifically focuses on advancing lower wage workers to higher wage jobs. And so we support the legislation because it ensures worker protections for people during public health emergencies. Now, we are bipartisan. We're independent. We don't necessarily have a specific skin in the game when it comes to businesses or employees, because we support both entities, specifically businesses that hire employees and advance lower wage workers into higher wage jobs. And so our dog in this fight is just to make sure that employees are protected. I want to specifically focus on three aspects of the bill. One, the part that expresses that there is a privacy to the employer's emergency action plan, access to free testing and reporting of positive test results during a viral pandemic, and rights to refuse dangerous working conditions. As we all know, the vast majority of essential workers are working in group positions like meat processing plants and with regards to military aspects and places like Amazon. What is not necessarily talked about enough is when somebody does test positive. As has already been stated on this on this call, employers are not necessarily health experts. So there's a lot of confusion that I've seen when I'm talking to my constituents on the job for how these things are actually to be discussed or deciphered. And just to bring one specific story that I think that this bill will actually do a really good job in fixing. My own brother, who is a person who's on the reserves right now and is currently at work, he wanted to testify, like many people wanted to testify who are essential workers, but unfortunately can't because they are doing the work of essential workers right now. When he came into work, and in a nutshell, there was a person who was there, another recruit, who basically tested positive for COVID, but he did not know it. He came in sick because, as was already mentioned before, this person came in not knowing how the rules necessarily worked and did not want to lose pay, so he decided to come in anyway. So he came in, was very, very sick, and in a nutshell, I don't want to waste anybody's time here, there was a massive COVID outbreak. However, management knew about this, and they did not actually do or change or anything about it or make any moves because there was arguments at the top that simply said, well, you know, most of the people who work at this industry are much younger, so the chances of them dying from COVID-19 is very, very small, so they should be just fine. Of course, other management realized that that's a massive legal liability. So what ended up happening?
Mr. Dews, we're going to have to bring this to a close.
Yes, then let me close it up right now. Just by saying that because there was no emergency action plan, both my brother and many other workers ended up having to stay home, lost a lot of pay, there was no plan. Many of them tested positive, and employers were kind of just scattered on that entire position. So we think that this piece of legislation will fix a lot of those issues, and will unify businesses and the state on the same level. For those reasons, we urge a favorable report. Sorry for the delay.
Christy Ann Marguerite. Ms. Marguerite, if you're with us, we need you to unmute yourself. All right, then let me move on. Jared Shablin.
Good afternoon, Mr. Chair and honorable members of the committee. Can everyone hear me?
Yes, sir.
My name is Jared Shablin, and I'm the chair of the Lower Shore Progressive Caucus here on the Eastern Shore, covering District 37 and 38. A large segment of our membership is essential workers. Our members work in healthcare, retail, food, poultry, and many of the industries most at risk due to COVID. Despite being called heroes by many, almost every single one of them have come to us with horror stories about unsafe conditions or subpar pay for their work, keeping everything going during the pandemic. Since March 2020, there have been over 333,000 positive cases, nearly 6,700 deaths, and roughly 25,000 people hospitalized in Maryland. These stats are made even more concerning to us on the Eastern Shore with the release of the CDC report that found rural Americans are at a higher risk of severe illness from COVID-19 because we are typically older than non-rural populations, have higher rates of underlying chronic disease even after adjusting for age, and often have a lower standard of care than urban areas. These numbers are more than just numbers. It is drastically affecting our rural way of life and is causing many of our members and their family to face daily levels of extreme stress due to the risk of catching COVID and dying from it. To make matters worse, many of our Eastern Shore workers are forced to use their personal leave or go unpaid when they are quarantining or mourning a family member's loss. This reality is cruel and entirely preventable, No working person in Maryland from the Eastern Shore to Western Maryland and everywhere in between can afford to go without pay for weeks to be in quarantine or mourn family loss. This legislative body must require employers to provide 14 days of paid quarantine leave and 3 days of paid leave to help workers cope with the financial and health burdens. Another issue that has arisen from this pandemic is that many of our frontline workers are struggling to make it financially. If calling our frontline workers heroes is more than just a performative gesture to make ourselves feel better, then we must ensure that employers pay their workers who are at risk both their own and their family's life fairly during this pandemic. To ensure that frontline workers are paid fairly, the state must mandate hazard pay for workers on the front line during this health emergency. Hazard pay of $3 an hour will compensate workers for the harsh conditions that they are working in and will help them take care of their families during the financial crisis we find ourselves in. In addition to regular pay, this hazard pay should also be given for shifts worked during the state of emergency. Finally, the state should allow employees to enroll in insurance through Maryland's Health Benefit Exchange to ensure they get the health care they need. Doing this will help workers and their families and slow the spread of the coronavirus by keeping workers healthy and on the job. The Maryland Essential Workers Protection Act is a common sense bill that would not only help our workers survive the financial and health crisis we now face, but also help our state better prepare for the next crisis. For that reason, the Lower Shore Progressive Caucus urges legislators to stand with workers by supporting this bill and give it a favorable report in committee. Thank you.
Mr. Chair, you're muted.
Is Rhonda Davis with us?
Yes, I'm here.
Please begin your testimony.
Thank you. To Chairman Davis and members of the Economic Matters Committee, this testimony is on behalf of thousands of essential workers who could not take the time off. My name is Rhonda Davis, and I worked for 13 years as a dietary cook at a long-term care facility in Baltimore. I cook evening meals for our patients and make sure to meet their special dietary needs. I support the Maryland Essential Workers Act. My employer has done mostly a good job responding to COVID pandemic. They acted quickly to make sure we had good PPE and gave us hazard pay. At first, we didn't have to use our sick time or vacation days if we contracted COVID, and they ensured we had safe rides to and from work. I and most of my coworkers have already been fully vaccinated or received at least one dose of the vaccine. Unfortunately, my story is not the norm. When I talk to my other union members at other facilities, I am shocked by the horror stories. Many of them did not receive PPE at all. And when they did, it had to be reused to the point it was no longer protective. They did not get hazard pay, and they were rarely tested, if at all. And they have to use vacation days or take unpaid time off if they get COVID. Unfortunately, my job has now switched to that policy, which I don't think is fair. The Maryland Essential Workers Protective Act will require facilities to have a pandemic emergency action plan in place. My experience has showed how much safer it is to work in a place that had a good plan compared to the facilities that did not. It's time to protect people who are working on the front lines during COVID. Essential workers deserve PPE, hazard pay, and a concrete pandemic response action plan, no matter where they work. Please pass this bill. Thank you. Rhonda Davis, member 1199 SEIU, United Healthcare Workers East.
Thank you. Let me switch over now. Louis Campion.
Thank you, Mr. Chairman, members of the committee. For the record, Louis Campion with Maryland Motor Truck Association. I just want to offer three specific concerns for the trucking industry. One is that this industry is incredibly diverse, and it certainly will be impossible for some of the industry to absorb the cost increases that this bill requires. And the industry includes everyone from household goods movers to gasoline haulers, grocery store, construction, package delivery, retail, and many more. And they range in size from one gentleman in his truck every day up to literally companies that run thousands of trucks. And, you know, to be very honest, right, for some business it has totally fallen off of a cliff. And for others, it has skyrocketed. But with this bill, right, those who have little demand for their services, they have no choice but to either cut expenses, which this bill mandates they take on, right, no matter what the impact has been on their business, just because they're deemed essential. And I think we've seen and heard testimony that demonstrates that for some essential industries and even certain segments within a singular industry like my own, that they, you know, that they have not had the same increase in business that some others have. Secondly, is the application to contractors and subcontractors, which has really not been spoken about. At least 75% of the drivers that serve the Port of Baltimore are independent contractors. These drivers own their own trucks. They lease to a motor carrier for specific loads, and they're delivering a load for a set upon agreed price. They can choose to turn the load down if they want to. So it's impossible to understand how this bill would potentially apply to them given the application to contractors and subcontractors. And lastly, we are concerned about the right of refusal and the potential for major supply chain disruptions. You know, trucking is playing an absolute pivotal role in ending this pandemic. As we witnessed at the beginning of the pandemic, when supply chains are disrupted, shortages of products are very quick to follow. And so by allowing employees to refuse to work, you know, you have great potential to increase and the time of deliveries, to disrupt and delay deliveries. And without trucking, there is no food on grocery stores. There are no medical supplies, no respirators in hospitals. There are no vaccines in your pharmacies. And so we need to make sure that the resilience and integrity of the supply chain is protected. And for that reason, we are opposed to the legislation. Thank you, Mr. Chairman.
Thank you. Nicole Christian.
Yes, thank you, Mr. Chairman and members of the Economic Matters Committee. I'm Nicole Christian, President and CEO of the Garrett County Chamber of Commerce, and I'm here on behalf of our 600 member organizations, Western Maryland, in opposition to 581. The regulations in the bill are excessive and costly. It's already been discussed that the definition of essential worker is too broad and encompasses most employers in Maryland, and I would echo those remarks. While we oppose the bill in its entirety as written, I want to focus on a few particularly troublesome parts. My written testimony does address additional aspects of the bill. The hazard pay, financial assistance for healthcare costs and health insurance, and allowing workers to refuse to fulfill their responsibilities are especially distressing. The hazard pay alone will irreparably damage these businesses, and making that pay retroactive will completely decimate most employers. I know there's been some discussion on this section, but section 1609, lines 16 to 17 specifically state that hazard pay dates back to the start of the emergency. In this case, that would be March 5th. To give you an example of that impact, one small business owner in Garrett County that has 2 restaurants would have to pay $267,000 in hazard pay up to this date if this bill was in effect today. This is the same small business owner who had to apply for PPP, EIDL, and other assistance to keep her doors open and to retain her employees. On top of the hazard pay, employers would be required to provide financial assistance for healthcare related to the illness and or health insurance if that employee is uninsured. Most small businesses currently are unable to provide health insurance for their employees due to the exorbitant costs, and to mandate this expense during an emergency is egregious. Employers should not bear the burden of paying for unreimbursed healthcare costs related to the emergency, especially when the employee is not even required to provide proof that they contracted the illness in their place of work. And to make matters worse, and even more challenging for employers during an emergency, this bill would allow employees to refuse to report to work to fulfill their responsibilities. The terms unsafe, physical harm, mental distress, physical health and safety are all unclear, and this bill implies employers would deliberately neglect safety protocols and harm employees. Additionally, the bill provides no means for addressing abuse by the employee or verification by the employer. The bill states that if a worker fears for their life or health due to the nature of the work being performed, they can refuse to work. An employer has no recourse for this refusal due to an employee's fears. Fear is not a reasonable term. Employers want to provide a safe environment for their workers, and most have made good faith efforts following CDC and Maryland guidance to implement safety protocols during the pandemic. Employers are frantically struggling to keep their doors open. The legislature is currently considering a relief bill to help these businesses, yet you're also considering this bill that will cause irreversible damage. Businesses need help, not overburdensome and costly regulations. Please give 581 an unfavorable report. Thank you.
Thank you. Sandeep Patel.
Mr. Chairman and members of Economic Matters Committee, thank you for giving me opportunity to share my comments regarding House Bill 581. My name is Sandeep Patel, and I own and operate La Quinta Inn and Holiday Inn Express in Maryland, in Waldorf and La Plata, Charles County. I employ close to 50 employees for past 27 years. I also serve as a director for Asian American Hotel Owners Association, AHOA, the nation's largest hotel owners association. AHOA has nearly 20,000 members nationwide, over 200 in Maryland and 60 represented by the members of this committee. My business is facing historical economic challenges due to COVID-19 pandemic. So far, the impact of this pandemic on travel industry has been 9 times worse than 9/11. The latest report from Maryland Lodging Monitor states that room revenue is down 60% in our great state of Maryland. Me and my family and my employees have personally felt the negative impacts of this pandemic. For example, our occupancy is around less than 35% compared to our normal occupancy for past 5 years between 65 to 70%. Has reduced our hotel revenue in excess of $500,000 in 2020. With such a huge loss, it is daily struggle to keep my business door open and my employees on payroll. House Bill 581 has a very troubling unintended economic consequences on a small family-owned business like mine and hard-working employees that we support. Hotel like mine already operates on a very small margin, but we proudly pay their fair share in the state and local taxes to support Maryland's economy. To be able to afford this proposal retroactive pay, I will likely have to delay hiring new employees, reduce the size of my workforce, or even close my door if after 27 years in business here in Charles County. Furthermore, I estimate that House Bill 581 would cost each of my hotel in Charles County in excess of $70,000 in additional payroll cost for the past retroactive pay. I deeply value extraordinary work that my employees do every day, and I'm proud of their efforts throughout this pandemic. My family and I share everything we can keep up to leave this hotel open. I'm concerned about these unintended economic consequences on our small businesses like ours, their employees and their families. I look forward to working with this committee on a solution. Thank you very much for consideration. As I said, these employees at my hotels been working for me for some of them for past 15 years. They are not our employees, they're my family members. I know their birthday, I know their kid's name. I know them personally. We would never do anything to harm our family members. So I am truly opposed to this HB 581. Thank you for taking your time today.
James Stark.
Good afternoon, Mr. Chairman and members of the committee. Thank you for taking the time to hear our testimony today. I run a hotel in Howard County, the Best Western Plus BWI Airport, Arundel Mills. The hotel has been in operation since 1989. And before the pandemic, you know, we were doing nicely. Since the pandemic, it's been an absolute struggle every step of the way to try to keep our doors open and employ as many as our staff as possible. And just to sort of reiterate what Sandeep just shared, we view our employees as family. I mean, we all know how many kids everyone has. We all know their names. We've known each other for years and years, and it was quite heartbreaking to have to lay folks off. And we can't wait to hopefully bring them back once we turn the corner. But I think it's important to note that both the federal government and the state of Maryland, the legislature and the governor have noticed just the complete dire straits that the restaurant industry and the hotel industry, the hospitality industry has been put in via 2 rounds of PPP, the $50 million that the governor allocated for hotel relief. So it is known that we are an industry that's absolutely struggling. And to be an industry that's absolutely struggling, the last thing we need are essentially more regulations and more cost. I know for my hotel, 133 room or upper mid-scale hotel, the average size hotel, average room count in the state is 114 rooms. For my hotel, we're losing between $30,000 and $40,000 a month just to keep the doors open. And we're doing that for several reasons. We're trying to employ as many folks as we can, and we're really just trying to hang in there to get through this pandemic. And we have a duty of care, both before the pandemic and during the pandemic and after the pandemic. We have a duty of care to our staff and to our guests. And we have gone above and beyond what the American Hotel and Lodging Association has recommended, what our brand has recommended. All the major brands have come out with guidance and guidelines. And to my knowledge, myself and all of my friends that are in the hotel business, we do above and beyond to do whatever we can for our guests and our employees. But the economic burden that this would place on us would be the difference in being able to sustain a few more months and hopefully see the light at the end of the tunnel, or just completely have to throw your hands up and close the doors. And I will say here in closing, I'm also the legislative co-chair on the Maryland Hotel Lodging Association. And I can speak for our entire committee. When we had a conversation about this bill and the negative effects that this bill would have on us economically when we're already in dire straits is quite catastrophic. Thank you for your time.
Thank you. Chris Patash.
Good afternoon, Mr. Chairman and members of the committee. Thanks for the opportunity to address everything with you for the next couple minutes. My name's Chris Potash, and I operate 2 self-storage facilities in the state of Maryland, one in Prince George's County and one in Anne Arundel. I just want to add on to a couple comments that Mr. Bariano had spoken about before. I'm active in the industry, and in discussions with peers and competitors, we do not believe that self-storage should be a part of this bill. Again, by definition, self-storage means self-service, where the tenant is bringing their goods to the property, loading, unloading, et cetera, et cetera. And the vast majority of the people on our properties are the tenants. Our properties typically operate with just one employee. We have best practices in place. So they're wearing masks. We've installed spit guards. We only allow one customer in the office at a time. And there's obviously ongoing sanitation. And with me in particular, we've gone above and beyond, and we've installed ionization equipment in our HVAC units that employ what's known as NPVI technology that eliminates pathogens and viruses. In addition, we've invested heavily in technology, especially since the pandemic, such that our business can be conducted online with limited face-to-face contact. We have self-serve kiosk in our offices, and a tenant even now has the ability to rent their unit online and make their payments online. So the interaction with customers is even less than before. There is ample space for social distancing in our properties, and really little risk for close interactions that would cause the spread of the virus. So although essential, We believe self-storage employees are at little risk for contracting the virus on the job. Thank you for your time.
Thank you, sir. Champ McCullough.
Thank you, Mr. Chairman, members of the committee. Champ McCullough on behalf of Maryland AGC, the Trade Association for Commercial Construction Companies. You have rather lengthy written testimony, and I'll try to save you the burden of listening to that verbally as well. There are three essential points. The first is that all of the safety provisions of the bill are already existing law. There is nothing in the bill that adds anything to existing law. Whether you look at the regulations promulgated by MOSH, or you take a look at OSHA regulations that the state has to adopt as an independent state, they cover every concern that has been iterated in the bill and iterated by the proponents. Now, there's no reason to create a completely different set of standards that overlap, conflict with, and generate confusion. So I would urge the committee to look very carefully at existing MOSH law and regs, and they will see that this frankly does not add anything. With respect to some particulars, the definition of emergency, as you've heard from many, is overly broad, and the bill is structured in such a way that when an emergency is declared, regardless of the nature of the emergency, every essential worker in every essential industry gets the additional leave and additional pay. That simply doesn't make any sense at all. With respect to the right of an employee to say, I'm not going to perform my task, that is already permitted under existing law. And you'll see in my written testimony the factors that go into it. So again, workers are already protected. With respect to a safety and health plan, that's fine in concept, but in reality, you have to know the nature of the health emergency that you're dealing with. And employers are not well suited to define the emergency and all of the necessary prophylactic action that has to be taken. By the way, sending that plan to MEMA makes no sense. MEMA is not going to do anything with it. They don't have the people even to look at it. Last but not least, the provision for health leave and covering all the health expenses. That comes into effect if the injury is in, quote, in any way related, so that the individual's non-work related negligence could entitle him or her to recovery. You know, you're commuting downstairs to your video room to work at home, and you slip and fall. Now, is that something that employers have to pay for? It's not work related. So again, I don't want to pound the nail through the board. You have my written testimony. I do think that the bill is very well intentioned, but has so many frailties that it should be given an unfavorable report. Thank you.
Delegate Adams.
Thank you, Mr. Chairman. Champ, let's talk about change orders for just a minute. You know, if I'm a subcontractor working for one of your general contractors and this law were to jump into effect, how would a subcontractor like me try to make myself whole? Because obviously I'm bidding a job firm, my contract amount is solid. I'll assume for a minute that I'm leading you on this, but change orders normally have to be for good cause, and then you have to have the owner, whether it's the state of Maryland or whether it's a private entity that's engaging you as a prime contractor, you have to get the owner's approval for the change order. But could you briefly just explain how something like this could be really problematic in the contracting world?
Well, the issue really goes to who's going to agree to the terms of the change order. The bill would impose a number of additional costs that weren't foreseen at the time of contracting. And so, subcontractor acting in good faith would go to the general and say, hey, look, these unforeseen factors have increased the cost of my performance, and therefore I need you to get that covered. As you said, leaving the GC to go talk to the owner. It is simply so problematic that it's difficult to see how this would generate anything but confusion and problems all up and down the contracting line, frankly.
Yeah, and so the only additional point I'll make and ask for your comment is that most contracts I've read, and these are 100-page contracts, but I take it upon myself to read my contract, generally have a very, very simple statement coming from the prime contractor, which is that you as a bidder are responsible for incorporating in your bid all state, federal laws. And that, in fact, as a subcontractor, if I came back and said to the prime and theoretically to the owner that I would want a change order, it would be easy for the prime contractor to say, read Article 5, Section B related to your obligations to know the Maryland and federal laws before you handed me a bid. Wouldn't that, for a smart subcontractor, basically disqualify me on projects because of fear of having to incur a cost for which there's no margin, frankly, to incorporate this kind of bill?
Well, given the broad definition of emergency and the type of work that construction contractors, since we're talking about that class, would be involved in, it is, as you say, a very common provision in construction contracts, particularly with public bodies like the state of Maryland, to require the contractor, as part of the boilerplate in the contract, to obey all federal, state, local laws, regulations, directives, et cetera, et cetera, et cetera. And if you are confronted with an emergency that you could not possibly have foreseen, it is nonetheless kind of tough noogies.
Thank you.
Delegate Charkouti.
Thank you, Mr. Chair. Thank you, Mr. McCall, for being here and for your thoughtfulness. I'm curious about if you could say more about MOSH, and I'll just share why I'm asking this. If I understood your testimony, it was that a lot of this is already covered by MOSH. It's already in the law. We actually had a lot of instances over the last 9 months where I would have thought it was covered by MOSH. I would have thought MOSH could establish an emergency temporary standard, and we have another bill that to some extent addresses that part of it, but could have established an emergency temporary standard, could have intervened in some of these cases. And MOSH, for the most part, said that these issues of workplace safety was up to the local health department. So so either, MOSH was an error over the last 9 months, in which case we need to take that up, or the issues of workplace safety that are being addressed in this and in another bill as well aren't in fact under what MOSH is able to deal with. And so I wonder where it is that you think MOSH covers this, and did you see over the last 9 months MOSH actually taking enforcement action on some of these safety issues?
Let me answer the last part of that first. If that was happening, my members either accepted it and never said anything about it, or it was such a minor issue that it wouldn't bubble up to the level of the association.
Wait, I'm sorry. If what was happening? Sorry, I didn't understand what you were saying. If what was happening, you didn't know about it?
No. I thought your question was I aware of situations where MOSH came out and was enforcing regulations in a COVID environment?
If they were enforcing it, that's right. Mm-hmm.
And if they were doing it, in such a way that my members had no objection to, so I never heard about it.
Yeah, I think that's the concern, is I don't think they were doing it, because when I was bringing and others were bringing issues to their attention, and in fact, when we held our hearing, it was and asked them about how many inspections they had done and so on. A lot of their testimony was pointing to it being local health department responsibilities. That's why I was interested in your earlier comments that seemed to say that you thought this was already in law under Moshe's responsibility. Is that what you meant earlier?
No, that is what I meant. And frankly, I would say that Moshe is in error.
Okay.
The general duty clause requires an employer to protect the health and safety of its workers.
Yeah.
And, if Moshe has a different point of view on that, I would respectfully say they're in error.
Yeah, I appreciate that. I think to some extent, some of where we are right now is I think some poor decisions along those lines, but I won't, I think then it's up to us as a legislature to figure out how to be very clear with the agencies so they can't make an erroneous decision in the rest of this pandemic or a future one. But thank you. I appreciate that. Thank you, Mr. Chair.
Right. Tammy Bresnahan.
Yes, sir, I'm here. Sorry about that. Mr. Chairman, my name is Tammy Bresnahan. I'm the advocacy director for AARP. And first, we just wanted to applaud you on at least starting this conversation about essential workers and their protections. And I just wanted to give you a little bit of data. 95% of the people that died due to COVID-19 were 50 and older, and that impact the impact of COVID has really had a dangerous and deadly impact on our older population. According to AARP Public Policy Institute, among all workers age 50 and older, nearly a third are designated as essential, equivalent to younger age groups. 29% of all workers age 65 plus and 27% of workers age 75 plus are designated as essential. In addition, Black and African American workers are the group most likely to be designated as essential. In the 50 plus age group, white only workers are the least likely to be designated as essential, and Black African American female workers, 42.3%, are most likely to be considered essential. Workers age 50 and older are an important demographic within almost all essential worker industries and occupations. In addition, 29% of low wage earners have been designated essential, and they are likely to be Black African American workers. Among low wage workers age 50 and up, 28% are white, 28% are Hispanic, and 30% are Asian. I give you these statistics just as maybe something that you can talk about and to think about when you're deciding what to do with essential workers. Workers age 50 and older are an important part of the U.S. essential workforce, but many of these workers, particularly age 60 and over, may face high risk on the job because of health impacts of COVID-19 and other dangerous diseases, and are generally more severe for older adults. Thank you for the time of letting me comment and for taking my points into consideration. Thank you.
Thank you very much. Tyronda Allen. Ms. Tyronda Allen? If not, Christopher Meyer?
Thank you, Mr. Chair, distinguished members of the committee. My name is Christopher Meyer. I'm a research analyst at the Maryland Center on Economic Policy, and I'm testifying in support of House Bill 581. The Maryland Center on Economic Policy is a nonpartisan, nonprofit research organization that seeks to advance a healthy Maryland economy that provides a broadly shared rising standard of living. We believe that House Bill 581 advances these values. A healthy economy to us means one that enables everyone to meet their needs and live with dignity. House Bill 581 would essentially ensure that essential workers are able to balance both their work, their livelihood, and their health. The bill also puts money in the pockets of families who are most likely to spend it, thereby supporting our economy, and supports public health, which means it will speed the recovery. The COVID-19 pandemic has created severe hardship for millions of Marylanders, whether that means the loss of a family member, the loss of a job or hours, or for many, going to work every day and risking their lives to provide essential services, without which Maryland communities simply couldn't keep going. Yet too many of these essential workers take home paltry wages, even as wealthy individuals and profitable businesses have thrived. As we can see, for example, through the stock market's skyrocketing performance during 2020. Half of essential industries have a median hourly wage that is less than the median in non-essential workforce industries' median wage. And essential workers in the food and agriculture industry have the lowest median hourly wage, only $13.12 an hour nationwide. That's 20% of essential workers nationwide. Another 30% are in the healthcare industry. And so when we think about the healthcare industry, that includes people like healthcare support workers, personal care aides who are already taking home very low wages. 30% of white workers in Maryland are, essential workers, compared to 42% of Black workers and 48% of Latinx workers. In comparison, every form of business and capital income is heavily concentrated among the wealthiest. 37% of business income goes to the wealthiest 6% of tax returns, 40% of interest, 77% of capital gains, 89% of partnership income. Every time that a worker protection is proposed, business lobbyists make sky is falling predictions. But as we see in the empirical literature about a minimum wage and other worker protections, those simply aren't borne out by reality. So if we want a healthy economy that supports healthy workers and a speedy recovery from the pandemic, then I urge you to make a favorable report. Thank you.
Thank you. Eric Chamberlain.
Yes, good afternoon, Chairman Davis and members of the Economic Matters Committee. Can you hear me?
Yes, sir.
Yes, my name is Eric Chamberlain. I will be testifying in favor of House Bill 581. I am a meat manager with Giant Food. I've been employed there for 24 years. We're represented by UFCW 400. And I can say through my experiences and observations, I consider myself not necessarily an essential worker, but an at-risk worker. Lots of the things that I've experienced in my grocery store, which used to have a limit of 150 people in the store, customers, but has appealed it to allow 175 people into the store, is the customers are, the employees, we do follow the social distancing, although customers have a hard time with that. In the beginning of the pandemic, we went from 2 pallets of meat a day to about 7 pallets of meat a day. And that was sustained for quite a long time. And we got a little bit of hazard pay to cover that. And the district manager and HR would come out to the store for each new case and let us know that there was a case in the store. Well, here we are several months later, and we're even more higher risk. It may not be such a sustained volume, but the customers are still brushing up against us while we're working in the stores. They no longer come out and tell us with the HR and the district manager when there are new cases, because the amount of cases has ballooned. There's so many new cases. There's constantly employees who are out and come back and tell us, yeah, we had COVID. So I feel like our risk has increased. I believe that the mandates that would be put against my employer by House Bill 581 would help ensure that my employer would do their best to decrease our risks. And I believe we're entitled to all those mandates. Emergency action plan, safe and hygienic working conditions, they're working on that, but they could be better. For example, only one entrance into the store because they have to count. We used to have 2 entrances. So they have to count the customers coming in and out. Well, because they have to go back out near the same way they came in, traffic flow crosses each other and they pass by our time clock. So we're constantly within close proximity to people who may possibly be infected. We're at high risk. And I believe that we do need these mandates to ensure that the employer keeps improving the protocol to keep us safe. And it's got a mental impact on us as well. I'm a divorced father. I spent my Christmas with my children in their garage with a mask on because I'm afraid to expose them to the risks that have been put upon me. And I thank you, Chairman Davis, for bringing this bill forward. And I ask all the delegates for their support for this bill.
Thank you much. Paulina Arnold.
Thank you, Chairman Davis, and members of the House Economic Matters Committee for the opportunity to speak on behalf of CASA in strong support of HB 581 today. My name is Paulina Arnold. I'm the employment staff attorney at CASA. CASA is the largest immigrants' rights organization in the Mid-Atlantic region with over 100,000 members. The majority of our members are low-wage immigrant workers who have been the core of Maryland's essential workforce. CASA members work as landscapers, construction workers, and grocery store staff, and are unable to work remotely during the COVID-19 pandemic. In many cases, they keep the workplaces of other essential workers safe in their jobs as janitors, sanitation workers, and superintendents. As Black and Brown essential workers, CASA members have borne the brunt of the pandemic emergency. Almost every member who comes to CASA for an employment-related legal consult has contracted COVID-19. Even if they don't come for a COVID-related consult, when I ask them if they've contracted it over the past year, inevitably the answer is yes. I'd like to highlight the story of one of our members from Howard County, who you can read more about in my written testimony, as well as the stories of other members. Juan worked as a construction worker at the beginning of the pandemic and was notified he was an essential worker who had to report to work every day. His worksite refused to enforce PPE. He bought his own mask, but found himself riding in a car between work sites with a coworker who refused to wear a mask and kept coughing. He was afraid for his family and reported this to his employer, and his employer told him that if he felt unsafe, he could leave. He left his job out of fear for infecting his family, but was unable to sustain them without it. He did not receive a stimulus payment or any federal aid. After his return to work, in order to support his family, he contracted COVID-19 and was hospitalized for almost a month without sick leave and without health insurance. HB 581 is necessary to protect workers like Juan and other CASA members who are on the front lines of this pandemic. We cannot entirely protect our essential workers from the risks of the pandemic, but we can require employers to provide as safe workplaces as possible for the most vulnerable workers. Thank you again, Chairman Davis, for your leadership on this legislation, and I urge the committee for a favorable report.
Thank you. Christopher Stevenson. Is Christopher Stevenson with us?
Christopher is speaking on behalf of 1199 SEIU. I believe it was switched out for Claudia Baylog.
I do not have that listed on my chart. Tell you what, let me go to Enrique Calvo.
Hello, this is Enrique Calvo. I am a political coordinator with SEIU Local 32BJ. We represent 20,000 workers in DC, Maryland, and Virginia, janitors, security guards, airport workers, and 175,000 workers across the Eastern Seaboard. So thank you, Chair Davis, Vice Chair Jemay, and members of the committee for the opportunity to testify in support of House Bill 581. The devastation wrought by COVID-19 on Marylanders, particularly on Maryland workers, shows the need for greater protection for workers. No worker should be forced to work in an unsafe work environment, yet the need to earn an income compels many workers to put their lives at risk. Empowering workers with the right to refuse to work in an unsafe work environment will compel employers to take appropriate steps to ensure that workplaces are safe. This will benefit not only the workers, but our communities as workplace spread is reduced. Similar incentives are at work when it comes to workers taking the time off to protect their own health. Without health leave, workers are incentivized to come into work, hurting their own health and that of their coworkers. Health leave is therefore an important, perhaps even necessary tool to stop the spread of COVID-19. Given that over 7,000 COVID-19 deaths, bereavement leave is also an important part of this bill. Just like workplaces must have emergency exit plans, so should they have plans to deal with emergencies like COVID-19. Unfortunately, plagues have become a common occurrence, throughout human history, and with our increased international travel and intrusions into the animal world, they may be becoming even more common. Our union members as essential workers have been working throughout this pandemic, cleaning and securing buildings. Building service workers and all essential workers should enjoy legal protections commensurate with the esteem with which we purport to hold them in. After all, many professional workers already enjoy many of the protections provided for in this bill. It's time we actually treat essential workers as truly essential. So for these reasons, I am urging the committee to ensure a favorable report on this bill. Thank you.
Thank you. Richard Deshay Elliott.
Hi, can you hear me?
Yes, sir.
Okay. Well, thank you, Delegate Davis, Mr. Chair, for the discussion that we had regarding this bill and for everybody else who's here. I'd like to present favorable with amendments. Give me 1 second so I can. I also want to designate employees in youth services and education, such as employees of local school districts, daycare providers, tutoring services and companies, youth service companies, private schools and universities, public universities, trade and vocational schools, and the Maryland State Department of Education as essential workers. To set the fines applied to businesses that violate health protocols at no less than 120% of the value of said employees' wages and benefits, so that it will be uneconomical to risk your workers' lives by default. To advance the implementation of the $15 minimum wage for businesses with more than 50 essential workers to the time of passage. To mandate retroactive $3 an hour hazard pay for all essential workers dating back to the declaration of the state of emergency, including workers who are no longer with their former employer, and without that money being applied towards benefit eligibility. Requiring that the rights and privileges on both the wage aspect and on health protocols be included in hiring documentation that is signed by both the hiring employer and the essential worker, in the worker's online training and available on site in English and at least one other language with translation services available, and from the fines for non-compliance with health protocols, that 80% of said fine revenue be allocated for the Maryland Emergency Medical Systems Operations Fund. I thank Delegate Davis for bringing this legislation forward. Essential workers have not been given the thanks that many people think they've been giving them. And if essential workers want to be get what they deserve, I think this legislation, increasing their pay, increasing the wages for the future, and ensuring that the protections that are extended under this legislation are widely known, whether the essential worker speaks English, Spanish, or Haitian Creole. I'd appreciate any questions from the committee. And again, Chairman Davis, I thank you for the time that we have to discuss this today and the time we've spoken in the past. That's all for my testimony.
Thank you. Claudia Blaylock.
Thank you. Yes, thank you. Can you hear me?
Yes.
Thank you, Mr. Chair, Madam Vice Chair, and members of the committees. My name is Claudia Baylog. I'm a lead researcher with 1199 SEIU. We represent over 10,000 healthcare workers in Maryland and DC. I appreciate this opportunity to testify in support of HB 581. The caregivers we represent are falling ill. Workers like Leticia and Rhonda experience the strain to our healthcare system when other essential workers unnecessarily fall ill. Too many people are reporting every day to unsafe workplaces. I just checked the state dashboard. Over 1,500 Marylanders have contracted COVID and another 35 have died in just the last 24 hours. From a public health perspective, it's critical to mandate that
I'm just gonna text you because he texted to me.
Delegate
that
Branch,
employers
Delegate
provide
Branch,
the
I
safe
can't hear
working
you.
conditions as outlined by the CDC and OSHA.
Hold on, Ms.
moratorium
Branch.
for the
Delegate
sky.
Branch, mute yourself. Go on, I'm sorry.
No problem. The problem is that these agency guidances haven't been enforceable. Our current regulatory tools, such as inspections, have lagged across industries and are clearly inadequate. So the right to refuse dangerous work, as already defined by the CDC and OSHA, is key to keeping workers and communities safe. Now, the Washington Post found 6 in 10 essential workers feared they would bring COVID home, and that fear of retaliation is measurable. Based on a survey conducted by the National Employment Law Project, 1 in 8 workers perceived retaliation by their employer if they spoke up about their working conditions. And Black workers were twice as likely to report retaliation and twice as likely to report unresolved COVID-related concerns at work. Another study found that only 2% of retaliation complaints were ever resolved by OSHA. Essential workers need hazard pay because costs such as childcare have gone up. Transportation costs are up. Workers depend on ride shares. Rampant short staffing across industries has workers needing to take on second shifts. Meanwhile, Maryland's hospital systems received $1.2 billion in CARES Act funding, and CARES Act grants to all healthcare providers in Maryland totaled $2 billion. While the top 20 US retail companies, almost all who operate in Maryland, have seen $17 billion in profit compared to last year. Those same companies are now reporting $7 billion in stock buybacks. Their workers are getting sick, and they and their family members are still dying. We can say with certainty that any bolstering of sick leave prevents community spread. A recent Cornell study just found that sick leave created under the Families First Coronavirus Relief Act for businesses with under 500 employees, it reduced COVID-19 transmission by 400 confirmed cases per state per day. 1199 knows that these protections are possible. Many other states, such as Virginia, have already taken these steps to keep workers safe. We respectfully ask the committee for a favorable report. Thank you for allowing me to speak.
Thank you very much. Chloe Waterman. Hold on, Chloe. I see Delegate Howard's hand up.
Yeah, it's been a couple witnesses. The guy that worked at Giant in the meat department, my grandfather worked for Swift before Safeway was a thing, retired from there as a meat cutter also. What was your name again, sir, if you're on? Going once, going twice.
Sounds like
it was Eric Chamberlain. Yeah.
Thank you, Eric Chamberlain. Thank you. And also to the previous Chris that was talking about the top 6% of people having all the wealth. Is that a national statistic or is that a Maryland statistic if he's still on?
Thank you, Delegate. That was based on Maryland tax data.
Okay. Okay. And Claudia, how many people did you say you represent?
1199 represents 10,000 workers in Maryland and DC.
Okay.
So more in Maryland, around 7,000.
So the top priority is the safety of the workers, I would imagine, correct?
The safety of our healthcare workers, but as a healthcare union, we take a stance on issues that pertain to community health and public health as well. And so as our members feel the effects of this virus, they actually feel it much more strongly during a pandemic when their communities are less safe. So we speak from both perspectives.
If your members are vaccinated against this virus, should they be, should they have the protections of this bill? They've been vaccinated.
Absolutely.
Why? They can't spread or get the disease. Per the CDC website, I'm looking at it right here, right now at cdc.gov. It says, with COVID-19, will COVID-19 vaccination protect me from getting sick with COVID-19? It says, yes. COVID-19 vaccination works by teaching your immune system how to recognize and fight the virus that causes COVID-19 And this protects you from getting sick with COVID-19. So if you can't get sick with COVID-19, why would you need the protections of this bill? Or is it about the $3 in hazard pay and sick leave? And I mean, can you give me some?
Sure. Well, first of all, I would say that not all of our members have yet been able to get the
Right,
vaccine.
I know, but as they come online and more vaccines come online, less and less people, in my mind, you can't get sick with COVID-19. So as this vaccine is more and more readily available, why would people need the protections of this bill if they can't get sick with the said, what this bill is based around, what your argument's largely based around, which is COVID-19?
Well, for our members, this bill impacts their ability to provide healthcare because our members are working in institutions.
They wouldn't have a negative, but there wouldn't be a negative impact to provide healthcare once they're vaccinated.
Claudia, let me jump in. I think maybe a better answer to Delegate Howard's question would be, because they're assuming that the efficacy rate of 95% is accurate, we're hearing more about different strands now, the African strand, the UK strand. So the vaccine, there's I guess dispute or lack of a better way to put it, as to the efficacy of it as it relates to various strands. And I guess as we get more strands, it's less clear as to whether or not the vaccine would work on those additional strands.
Okay, all right, well, thank you.
Righty, now let me go to Chloe Waterman.
Great, thank you, Mr. Chairman and members of both committees. Thank you for the opportunity to testify today in support of this legislation. I work for Friends of the Earth and am representing a coalition called Marylanders for Food and Farm Worker Protection. We are a coalition that formed in response to the conditions faced by food and farm workers, in particular during COVID-19. As other witnesses have mentioned, these workers have traditionally been excluded from worker protection laws, including in many cases, the right to organize. They are predominantly people of color, and many are migrants and immigrants. They tend to have low rates of unionization and are fearful of retaliation from their employees. So we'd really like to thank the sponsor, SEIU, and the other labor organizations in Maryland for ensuring that these workers are included in this legislation. Like in so many other sectors, we've heard horror stories from food and farm workers around the state, and they really have no recourse. The exchange between Delegate Charkoudian and Mr. McCullough earlier, I think, was getting to this point that MOSH really is not providing any recourse for workers now who are facing unsafe conditions and filing complaints with the agency. So they truly have nowhere to go. There's no mandatory and enforceable workplace protections in Maryland at this moment. We've heard stories of workers being forced to come in when sick. Purdue workers reported that their employers were forcing them to eat ice cream just before a temperature check in order to pass the temperature check. Family members of workers we've heard from who've died and not given time to grieve, workers who've been asked to pay for their own masks. You've heard the stories, the list goes on. I wanted to speak to the hazard pay issue. I can't speak to all small businesses and what they can reasonably afford. And of course, I'm sympathetic with some of the people who have testified today on what the impact would be. But for food and farm workers, Tyson CEO last year got paid $10 million, which is 294 times the median salary of its employees. So yes, they can absolutely afford to pay $3 an hour in hazard pay and have a moral responsibility to do so. Forbes ranks the Purdue family as the 86th richest in the country, worth $3.2 billion. Their employees, their average hourly employees make $15 an hour. They can afford it. I do want to acknowledge that there's some overlap between this legislation and Delegate Valderrama's legislation, House Bill 124, that Economic Matters heard on January 21st, in terms of providing safe and hygienic working conditions. Following that hearing and some of the recent announcements from OSHA and in response to concerns raised by committee members and witnesses, we've worked with SEIU, with other advocates to work on some language that we believe addresses those concerns. And so we would urge a favorable report of this legislation with an amendment to incorporate those adjustments to the pieces of the bill that relate to providing safe and hygienic workplaces. With that, I'll close. Thanks for the opportunity to testify.
Delegate Ahrens.
Thank you, Mr. Chair. Ms. Waterman, that was kind of a broad statement. You said Purdue makes people eat ice cream before they take their temperature.
I was reporting, I didn't mean to imply that that's a practice that happens across the board. I was reporting that we've heard from multiple workers employed by Purdue that they have been asked to eat ice cream before work in order to pass their temperature checks.
That's a very serious charge, I think, and almost borderline crazy. If that's happening, I would really appreciate you providing that information to us. That to me is, I appreciate the spirit of this bill. I appreciate the things, but stories like that, unless you could substantiate it, it's probably not proper for this hearing. You're besmirching a major employer in my district and my area. I just didn't appreciate it.
Yeah, I'm happy to provide substantiation for that. The workers directly are very fearful of speaking out, but we have a spouse of a deceased worker and several other people with direct information.
Provide me with that information.
Absolutely, will do, Delegate Ahrens.
Delegate Mounts.
I'm sorry, Chairman. I just, I don't really have a question, but I mean, I've spoken directly. I'd like to know also, because I've spoken directly to the about this, and Randy and Mr. Purdue speak directly with the employees on a regular basis. And I just, do you have, when you provide us some information on that, I'd also like to share with you some information on the millions of dollars that they've spent voluntarily to try to improve workplace safety. I don't have a question. I just need to put that on the record, because I spoke to Randy Day about this at length on multiple occasions, but most recently just 48 hours ago. So thank you.
Okay, let's move on to Scott Snyder.
Okay, thank you very much. I'm not going to, thank you, Chairman Davis, Vice Chair Dumais. Good afternoon. I'm a certified industrial hygienist, and I've been doing occupational safety and health for about 40 years. I'm testifying here on behalf of about 20 health and safety professionals in the state, and as well as with the National Council for Occupational Safety and Health. I'm testifying in support of the bill with amendments. I don't want to go over the same ground that everybody else has gone over, but we have worked with other groups to petition the governor to put out an emergency standard for the bill for COVID exposed workers, and that's been refused over the last 10 months. So what we are requesting is that the bill be amended to incorporate HB 124, temporary standard be published MOSH, and then a permanent standard 6 months later. Some have questioned the need for a permanent standard, but hopefully the pandemic will have abated by fall. But the answer is, number one, the pandemic still may have surges in the fall, depending on vaccine distribution and efficacy, as well as new variants, and due to lack of social distancing and mask wearing. And second, this may not be the last pandemic we experience. If and when a new pandemic arises, we will have the tools ready to meet the challenge. Secondly, while federal OSHA is currently considering issuing an emergency temporary standard, if they do, Maryland is required to adopt it, or a standard that's equally or more protective. You must require that MOSH adopt any federal emergency standard immediately. In the past, MOSH has dragged its heels and waited to adopt federal rules until all litigation has been resolved. This is contrary to OSHA procedures and would gut the intent of an emergency standard, allowing Maryland workers to continue to suffer without sufficient protections or enforcement. So I urge a favorable report for this bill with amendments, hopefully incorporating HB 124 into this as well. Thank you very much.
Thank you. Let's go to Drew Jabin.
Hi, thank you. Chair, Vice Chair, members of the committee. For the record, Drew Jabin on behalf of the Maryland Association of Counties. Respectfully here in opposition to House Bill 581 as written. As always, you have my written testimony. I will be brief. You have already heard from many witnesses, and I'm sure you will continue to hear from others. House Bill 581 will be extremely costly and a burdensome imposition on county governments. For the public sector, many employees fulfill functions that are truly essential and may be pressed into service to respond to the very emergencies triggering these protections. Although some county governments are already providing hazard pay to our frontline workers with a major fiscal impact locally, these expenditures will continue to increase significantly under this bill to provide more hazard pay and other benefits. The fiscal note already shows an extreme increase in cost, but these costs could be significantly higher as essential workers are often required to work additional overtime hours during emergencies to ensure the safety and well-being of Maryland residents. The bill also empowers necessary public employees with a veto on work responsibilities, which could jeopardize the safety and welfare of Marylanders. Lastly, I want to echo what has been said before. Counties have prioritized providing PPE, as have other businesses, and have continued to work to secure as much as possible. But again, there have been shortages, which is a major concern under current language of the bill. MACo does look forward to continuing to be a part of this discussion. However, as written, we request an unfavorable report on House Bill 581. Thank you.
Mr. Chair.
Delegate Adams.
Briefly, this bill, from a MACo perspective, is essentially an unfunded mandate. Would you view it as that?
Correct.
Yeah, and so this is one of the themes I've heard from MACo a number of times, but it's also an unfunded mandate on every employer. The state of Maryland might be at some advantage because you can always raise taxes on taxpayers to, in essence, pay for the state impact. But when we're talking about local governments and we're talking about private employers, we have no such easy mechanism to do that, which makes the bill unworkable. On a federal level, when we had this past pandemic, the PPP loan was the funding mechanism for the mandates that were coming down to close and alter operations for business. The state of Maryland can never come up with a fiscal note to actually fund this mandate. Agree?
I'm sorry.
We can't afford to put this mandate on governments.
I would agree with that.
Thank you.
For local government. Thank you.
At the risk of starting something, I think I'll leave that alone, but my sympathies are more in line with some of the concerns raised by the private sector. I know some of the things that MACo and the government has supported and proposed, so I'll leave it at that, but
I appreciate those comments, and we definitely look forward to working with you in the committee to figure this out.
Thank you very much. Delegate Howard.
Thanks, Chair. Hey, is the intent of this bill, so I guess it's probably for you, Chair, we talked a little bit about vaccination and protections from under this bill and whether people would receive those protections if they've been vaccinated in current and maybe evolving strains. Just a thought popped into my mind. I mean, as we move forward, there's going to be a level, right? So there's going to be a PPE standard for COVID-19. And then somebody gets vaccinated for that. And then there's going to be a COVID-20. And let's say there's a different PPE standard for COVID-20. And then there's a violation by a small business in Maryland on a PPE standard from COVID-19 and COVID-20. Under this bill, even though that person was vaccinated for COVID-19 versus COVID-20, that violation would still stand and that business would still be subject to fines and/or penalties, correct?
I don't think that's, and it's probably a much more detailed discussion or answer than what I can give now. I don't think in and of itself, like an occurrence triggers a violation. I think the violation comes after, if certain things weren't met or weren't done. I can't think of an example. Maybe they hadn't turned in their plan, but I don't think simply because, someone got sick or something happened, then that means that the business or the government, as the case may be with MACo, that they necessarily committed a violation.
Okay, we'll talk. And I'm not trying to trap, or I'm just trying to work this out.
No, and I certainly don't take it that way.
Okay, please
These are
don't.
legitimate questions being raised.
Yeah, please don't, because I'm just trying to work the mechanics of it out in my mind. Okay, thank you.
Oh, no, no, these are all important questions. I fully expected them and they should be asked.
Thank you.
Let's go to Bryce Phillips.
Good afternoon, everybody. I really appreciate the time being given to us today. I want to thank the chair and the vice chair and entire committee for hearing me out today. Phillips Seafood and our related companies firmly oppose HB 581. Phillips has been in operation since 1914. We've been successful because we treat our staff well in all aspects of their employment, including fair pay and safe and respectful working conditions. We have 3 manufacturing businesses to which this legislation would apply. We employ approximately 105 people, 70 full-time, 35 seasonal. The average tenure of these full-time employees is 16 years. HB 581, if passed, will result in the elimination of jobs for many of our hardworking staff and loyal staff members. The proposed $3 per hour hazard pay would result in approximately $426,000 in added payroll costs per year and would result in us simply shutting down during declared emergencies. The margins in our business are just too small to overcome this. Currently, when it is safe to do so, we do stay open during emergencies to give our staff working hours and to ensure the continuity of our business. Paid leave is already offered to our staff. Requiring more on top of the generous allotment our employees already receive is simply unaffordable. And our businesses are already suffering. All of them, absolutely every single one of them right now is on the proverbial chopping block if this pandemic does not subside soon. And based on some of the information that I saw this week in our trade association conference from 210 Analytics, only 30% of Americans will be vaccinated by the end of this year. And this pandemic is going to last far longer than what everybody thinks. Adding additional costs to these businesses right now is not the right move and will exacerbate business failures and closures across the food production industry. And I say production industry because, as I understand, restaurants are not included in this bill. If they are, the expenses are going to be far higher for us. Additionally, I believe it's unrealistic and unfair to require employers to bear the burden of financial support to essential employees who become sick or injured if the sickness or injury is related to the emergency and is not business related. My question's back. How and who would determine if the sickness or injury was related to work and the emergency? Why would the business bear the cost that was not related to business? Who determines if the healthcare cost was related to the emergency? How would all of the out-of-pocket expenses be determined? Health insurance was created to cover individuals for illness and injuries. And with this bill, you are now requiring the business to take responsibility for individual responsibilities. Additionally, the bill is so poorly defined in this area that a bevy of lawsuits related to this is a virtual certainty. Regarding the definition of the emergency, the way the bill is written, the definition is simply too broad, as you've heard several times before today. This bill calls for periodic evaluation to determine if an emergency is imminent, occurring, or has occurred. With all due respect, if a study must be done to determine the presence of an emergency, there is no emergency. I also want to fully mention that I fully support the comments made earlier by Melvin Thompson from our Maryland Restaurant Association. I thank you all for your time today, and we firmly oppose this legislation, and we hope that it does not get passed. We think it's going to undoubtedly create unsustainable hardship on the Maryland business community, which will certainly result in significant reduction in or loss of jobs. Thank you.
Thank you. Aubrey Vincent.
Hi, how are you doing? Can you hear me?
Yes. I think you just went mute though. Aubrey Vincent.
Oh, hold on. Can you hear me? Oh.
Yes.
Can you hear me? Okay,
Yes.
sorry, technical difficulties. Zoom issues.
Understood.
I apologize. I don't mean to waste anybody's time. First, I want to say thank you for giving me the opportunity to testify today. I'm testifying on behalf of Lindy Seafood. We're a small seasonal employer, seafood based, located on Maryland's Eastern Shore in Dorchester County. I'm I'm speaking out against this bill, which I feel if passed in its current state has severe negative consequences for both small essential employers and employees in districts like mine. My experience this year, which I think we've had a lot of conversations today, a lot related to larger employers. It seems like there's a lot of frustration about huge windfalls that people have felt like large employers have had that haven't been passed on to the employees. Our experience in this pandemic couldn't have been farther from that. We're seasonal in nature. The majority of our employees work 7 to 8 months a year, have been with us now 15 to 20 years. So for us, the health protocols that we needed to take, often without unclear guidance from the CDC, we did all of those things because we knew that that was what was in the best interest of our employees and our business. So I find it very disturbing to hear that a lot of people have had very different experiences for ours. What I see in this bill is a lot of expenses that businesses like mine would really have a hard time trying to capture and then make business decisions with. For example, as of right now, I'm an employer that doesn't offer health insurance due to the seasonal nature of our business. It would be difficult for us to anticipate those costs, then be able to arrange coverage for our employees, and then also be able to cover those additional costs during an emergency. So I feel like there's a lack of clarity there for how that would play out for our business and also for our employees. I think some of the issues we are discussing are larger societal issues, and I don't think this bill can have the scope to solve those problems. Some of the health insurance and health access problems we have here on the Eastern Shore are not problems that us as employers can necessarily come up with solutions for. One of the other things that I also wanted to mention too was what we ran into, and I'm sure this has been other employees as well. We have had a difficult time being able to source PPE. We were at a point at the beginning of the pandemic where we actually had to create our own masks, make sure we were able to supply those kinds of things for employees because our hospitals and things like that didn't have the supplies they needed. So one of the things I would like to see discussed in the future with this bill is how some of those problems would be addressed. Because I know for ourselves, we, like many others, were forced to come up with creative solutions to try and keep everyone safe. And I think those are discussions that need to be had. In summary, I think it's been an unpredictable emergency for all of us, the pandemic, and the burdens have also been carried by all of us, employees and employers. I think it's my opinion the bill is an attempt to address society shortfalls in the face of emergency, and I think it misses the mark by placing all the burden of these shortfalls on employers. Societal problems require solutions that pull from multiple sources. Employers can't do that alone. Thank you.
Thank you very much. All right, I'm going to give this a try. Forgive me if I get it wrong. Adam Rybczynski. Don't make me say it again, Adam. All right, we'll assume that Mr. Rybczynski is not with us. Nicole Stallings.
Yes. Hi, can you hear me, Mr. Chairman?
Yes, ma'am.
Great, thank you. Thank you, Mr. Chairman, Madam Vice Chair, and members of the committee. For the record, Nicole Stallings on behalf of the Maryland Hospital Association and our 60 member hospitals and health systems. Thank you for the opportunity to offer comment on House Bill 581. I will be brief. As the committee knows, our hospitals and their dedicated caregivers have been on the front lines of the battle for COVID-19 for nearly a year. They answered the call quickly and with full force to save lives and to care for their communities, treating 32,000 COVID patients since March. The demands that were placed on the hospital field have been well documented, and we've addressed those challenges and can continue to do so, adding 6,000 beds for additional capacity in just a few months, shoring up scarce resources like personal protective equipment, medications, ventilators, redeploying and cost training staff, trying to keep track of the constantly changing guidance for a novel virus, testing hundreds of thousands of patients, community members, and staff, and now shifting to vaccinations. And all of this was done while continuing to care for patients during multiple acute care surges. And none of this could have been done without the dedicated and tireless work of the more than 117,000 caregivers who work in our hospitals. They have been rightly celebrated as heroes. Our top priority is the safety and well-being of those caregivers. They are essential to fulfill the mission of care that hospitals have 24 hours a day, 7 days a week. In my testimony, I outlined the ways in which we have demonstrated that commitment to our staff to ensure access to PPE when a global supply chain shut down, to provide essential wellness and mental health supports, supporting childcare, transportation, meals, lodging, the list goes on. We procured those resources, we provided those supports, not because they were mandated, but because we care for the people who care for our communities. So I want to use the remainder of my time to just acknowledge that the operations of a hospital, the safety protocols inside and outside of a public health emergency are extensively governed by myriad state and federal regulations and subject to extensive enforcement. Many of these things have been touched on in the bill and do need to be accounted for moving forward. Let me just conclude with the time that I have left to say that while COVID-19 has been unprecedented, our commitment to our staff, their patients, their well-being, their safety is steadfast. Our top legislative priority is protecting our workforce, and we look forward to being productive parts of this conversation in the work session. And with that, I'll conclude my time. Thank you.
Cootie.
Thank you, Mr. Chair. Thank you, Ms. Stallings, for being here and for your constructive conversations on many issues through this process. I guess I'm trying to understand, we've heard from several people and I'm trying to streamline my questions, although I am interested in this often. When we have legislation that sets certain standards and folks come in and say, we're doing most of this, or we have everything in place already, or we're doing the things that are the right things to do, so we don't need this legislation. And my question is always sort of, what is the gap? What would this change for you? And then why are you opposed to that? I do appreciate it. I know that hospitals have done a lot, and I know that your employees have done a lot, and I know that in some hospitals have done better than others, and we've certainly heard employees of some hospitals really struggling with their employers, and others with employers who seem to have done much better. So I guess I'm trying to wrap my head around what you're saying is the baseline that's already happening, and then what would this add to what it is that you're doing, and what are your concerns, I guess, specifically with that gap?
Sure. So thanks for that question, Delegate Charkoudian. As I noted in my testimony, we want to ensure that these provisions do not create conflicting standards. I think in some instances, that's a very simple fix, referencing the standards, saying have a policy to address. In other situations, like right to refuse, for example, that creates significant patient safety concerns for us. To have someone to be able to leave the bedside would put a patient at risk. And there are existing provisions from OSHA that already provide for a process with certain conditions. So we just want to ensure we're going to sit at the table, we're going to be very productive and constructive here, that we aren't creating any sort of undue conflicts. And that we're also taking into consideration the potential impact of if a hospital cannot meet these requirements, what does that mean? And so we'll certainly come with those examples in the work session.
Okay, thank you. Thank you, Mr. Chair.
Right. Our final witness, Ellen Valentino.
Yes. Thank you and good afternoon, Mr. Chairman. My name is Ellen Valentino. I appreciate the opportunity to appear today and to be the final witness. I'm here representing the Mid-Atlantic Petroleum Distributors and also the mechanical contractors in Maryland. One thing I just think I want to remind the committee, and this has just been a horrific thing, is the pandemic remains underway. It's not over. And yes, it's important to review, evaluate, and put into place policies and laws to prepare for what I suspect we hope doesn't materialize in our lifetime again, but the potential of another horrific event. And, I think there's consensus here that has to be done. But you know what? There is just so much that needs to be reviewed. not just an employer's workplace, but also government's responsibility in the employer's workplace, the government's responsibility to employers, our responsibility to our employees, and individual responsibility. And I got to tell you, I think they all do go together. If this is about back pay and hazard pay, then that's something that needs to be addressed, put up front, and we can talk about that. Is if this is about what it looks like next time we have a pandemic, we got to take a moment, because I think it's going to be so important to get it right, because what we went through as employers was stunning. You know, we scrambled. People forget we scrambled for PPE. We scrambled and traded for PPE. We closed because we didn't have the proper PPE. So I guess what I'm saying is I understand what have we learned. I don't think we're finished yet. As sadly enough, I think we got a row to hoe here, a boat to row. You get what I'm trying to say. And you know, if the rush is how to look back and what happened and how we respect and help those people on the front line, let's do that. You know, that broke my heart. It breaks my heart when I walk down the street where I live, where it says, thanks, it's been great, we're closed, not reopening. Don't forget us. So I want to be involved in the work group. Again, I don't think we can afford to get it wrong if this is about what we do next time. But I also think we can take a moment to discuss where we are today, and if we need to right some wrongs, let's look at that. But I think, I'm urging a pause of passage, not a pause in deliberation, and look at Maryland, look at the government role. Do they have a role to individuals and essential workers? And what does that look like if we can't afford it as small business owners? So thank you. And I look forward to seeing you in your work group.
Thank you very much. Is there Nicole Stallings with us?
You already got me, Mr. Chairman.
Okay, I thought so. With that, I'd like to thank everybody. As a matter of fact, it would be remiss of me if you could just give me a second. I understand certainly how emotional this debate or this issue is for some. Your businesses, your livelihood on the line on one side, and the other, your workers, your safety and the safety of your family is at stake as well. So given the magnitude of what we're discussing and the potential impacts, I want to thank everybody for a very respectful debate. Everyone, you did a great job. I certainly appreciate the thoughtfulness in your remarks. I appreciate, being able to disagree, as they say, without being disagreeable. And hopefully nationally, we can learn to do what you guys did here today. So thank you all very much. For the members, we have a voting session Monday at 4:30 or whenever we get off the floor. And with that, thank you and have a good weekend. Enjoy the Super Bowl.
Thank you all. Thank you, Chair. Thank you, everybody.
Mr. Chair.
Have a great weekend, guys.
Take care, guys.
Go Chiefs.
Oh, come on, man.
It's
Go
the
Chiefs.
Bucks. Come on,
That's the
Bucks.
second time I've heard that today.
The Bucks. Go Bucks.